Lovely to see you all here. Thank you very much for coming to the student session. My name's Sue Jones and I'm Executive Head of Education at the IBMS. So I'm welcoming you formally to the session this afternoon, talking a little bit about the session and what's in it, and some things about routes to registration, because that's something that people ask me about a lot. So how do I get to be a registered biomedical scientist? And then I'm going to do a little bit more on other things that the Institute do as well. So hopefully you enjoy the session. We've got a really good lineup of speakers for you this afternoon to tell you about all different aspects to do with being a biomedical scientist and other things that you can do as well. So, to start off, this is my bit, so formal welcome to the session and then about routes to registration as a biomedical scientist. And then we've got a really nice selection of talks, and we've built in lots of time for you to have a break so that you can network, talk to each other and talk to the speakers. So we've built in a half-an-hour break and a 20-minute break. There are no refreshments in this room, but if you do want to go and get a drink somewhere and bring it back, that's fine. And it's for you guys to get up and walk around and have a chat. So please use that time to wander around in here and go and speak to the speakers that you want to speak to. So in the first part, after my introductory bit, we've got 3 different talks which are all about the registration training portfolio and going on placement. So if you just give me an idea, just pop your hands up. Is anybody in the second year at university thinking about doing a placement? Okay, good. Hopefully that'll be useful to you. And has anyone been on a placement and come back into the final year? Lovely, so you can help answer some questions as well. So we've got all of these 3 talks based around what is the portfolio, what do we need to do with it, and about the assessment at the end. So we've got some really good speakers to talk to you about all of those bits of the process. Then in the second bit, after we've had our break where you can network and chat to lots of people, we've got 4 lightning talks about the different disciplines that you can work in the NHS. So we couldn't do all of them, there's too many. So we've picked 4 that should be relevant to you from your second year modules that you'll be studying. So we picked out haematology, histology, microbiology and clinical biochem. Then you'll have another break to do some more networking, and then the last bit of the day is about, if you're coming up to the end of your final year, you're starting to think about what you might want to do afterwards, some hints and tips about what you could do to think about getting ready for employment. And then again, some lightning talks at the end of the day of graduates who've gone on to do other things. So the focus of today is about being a biomedical scientist, because that's kind of what my role is to tell people about. But you can do lots of things with a biomed degree. So we want to tell you about some of the other things as well. We'll try and finish on time. I know people have got coaches and they've got trains that they need to go for, so I'll try and keep everyone to time because I'm chairing the session as well, so we can finish on 5 o'clock and you can get going. So, first of all, who are the IBMS? So people get very confused about who are the IBMS and what do we do, and who are the HCPC and what do they do. So I thought it might just be useful to clarify the difference between the 2. So the IBMS stands for the Institute of Biomedical Science, and what we do is look after people who work in the profession or who are training to be biomedical scientists. One of the other things we do is we support accredited degree programs. So one of my jobs is to go and look at those programs, see what the content is, see what's being taught, make sure it's fit for purpose. And we do that in a 5-year cycle. So are you all doing accredited degrees? Good, lots of nodding, good choice. So we look at that as one of the things that I look after. And for our people who are in practice, we do lots of things around their education and training as well. So becoming a biomedical scientist isn't the end of the career journey by any stretch. There are lots of advanced and specialist roles in biomedical science, and my colleagues look after that higher and specialist training as well. So we have lots of support for all of our colleagues who are working in practice, academic colleagues, and for students as well. Where the HCPC come in is they are the regulator. So they regulate 15 professions to say that those people are safe to practice and they look after patient safety. What we are as the Institute is an approved education provider, so we are allowed to deliver 4 different routes to registration. So the HCPC look at us as an education provider in the same way that they look at a university. We've got to evidence to them how we run our programmes, that we do it properly and that they're fit for purpose as well. So we have different routes to registration, and that's what I'm going to talk you through in the second bit of my talk. So if you want to find out any more information about the IBMS, it is on the website. It's really easy to find the website, and you can find information relevant to students. So just to let you know how big the IBMS is, we've got over 21,000 members, and those members are in lots and lots of different categories. So they could be students like you, they could be trainees, they could be people who are more advanced in their career. We have a whole range of different people, and we actually have them from around the world, so predominantly based in the UK, but we do have people from 74 different countries around the world who are members of the Institute. And what we do is the professional body is we support all of our colleagues in whatever they're doing as far as education and training and further in their careers is concerned. That's our job, to promote and support people who are working in biomedical science. So we've got a range of membership levels. Hopefully some of you are e-student members already. Could you give me a wave again if you're an e-student member? Oh good, I can do some recruiting. So membership have asked me to let you know what you need to do to be an e-student member. So an e-student membership is really cheap, and you get quite a lot for that. So it's £12 if you pay as an individual. If you want to, you can be an individual member, or you could go back to your university and say, if you bulk upload, if you tell them there's loads of us, more than 25 of us want to join, you get it at £11. So it's a slightly cheaper price. So you could talk to your course tutors about it, or if you want to do it individually, it's £1 a month, basically. And if you join now, you get the rest of this year and all of 24 for £12. So you actually get quite a lot of time. So for the end of this year, that will be thrown in free, and then you'll get all of 2024. There's a QR code, and we've got it on the stand as well. So if you can scan it from where you are, that's great. If it doesn't work, then we've got the QR code on the stand, or you can just go to the membership section on the webpage and you can have a look. So anybody who's doing an accredited degree, whether it's a BSc or an MSc, is able to be an e-student member. And the application process is all online. If you follow the QR code, it will just take you straight through. You can do the application, and then once you've done that and you've done the application to join, it will be processed and you should have access from the next working day. So if you're interested in doing it, if you want to visit the IBMS stand on the way out, or if you can scan the QR code, I can pop it back on during the breaks if you want to have a look at that. These are the things that you'll get. It's quite small writing, but this is all on the website. So these are the kind of things that you'll get if you're an e-student member. So you'll get access to the monthly magazine. You will also get the British Journal of Biomedical Science as well, free. And then you get lots of other things. You get discounts on things as well. We do IBMS support hubs. So Tahmina, who's going to talk this afternoon, and I are doing some support hubs, and they're based around students, and there's some things that you might find interesting. We're just starting to ask people, what would you like us to do for next year? So if you've got some ideas, there are 1 hour session on a Wednesday lunchtime once a month, and we'll do whatever you want us to do if that is helpful. So whether you're a member of staff, whether you're working in academia or in practice, or if you're a student, if you let us know, then we'll try and organise a session around a topic that you're interested in. Okay, so that's who we are as the Institute. Who are the HCPC then? They're different to us. So as I said before, the HCPC is the regulator. So they regulate the professions that they have listed on their webpage. There's 15 of them. They look after physios and OTs, as well as biomedical scientists and clinical scientists. So there's 15 different professions, and the job of the Health and Care Professions Council is to make sure that the people who are practicing doing those jobs are doing it well and doing it properly. They've had the right training and they know what they're doing. So they're the regulator. So to be able to call yourself a biomedical scientist in the UK, you have to be registered with the HCPC. So you've got to have done the right training, the right degree course, and I'll explain the routes to registration to you in the second bit of the talk. So they are the people who hold the register for those different professions and who is on the register and is able to practice. They set standards of education and training, and that's where we come in, because we support that through our accredited degree programmes and through our training in the laboratories. And they also set the standards of proficiency. So anyone who did a placement last year will hopefully have been collecting lots of evidence for the registration training portfolio, and that's what we use to measure the proficiency. So that's when you're in the lab, that's showing your lab skills and your abilities in a practical sense. So you need both of those bits to be able to register as a biomedical scientist. Once you are on the register, you're called a registrant. So people who are on the register, so we've got Cherie and we've got Tahmina who are going to talk to you, they are already on the register, so they're called registrants. And once they're on the register, they've got to maintain those standards. So you need to meet the standards to go on, and you need to maintain those standards to stay on as well. So what they can also do, the HCPC, is they look at who's on the register, and if there is a cause for concern, if somebody raises an issue, then they can investigate the person as well. So it's about maintaining standards, but really about patient safety, making sure that everybody who practices in the UK is doing what they should be doing and knows what they're doing. Okay, so again, if you're interested in the HCPC and what they do, their website is really easy to find, and you can find more information. So where we come together is we work on the behalf of the HCPC to check the degree courses that have got IBMS accreditation, have got the right bits and bobs in. We also have the registration training portfolio. We own that, we write that. I've just rewritten it for the new standards that have come out, so that's been quite a big piece of work this year. So we look after the registration training portfolio, and we look after degree accreditation. So we help the HCPC to get people ready by looking after that education and training piece, whether it's in the lab or whether it's in university. When you've finished both of those bits, then you will be able to ask the HCPC if you can go on the register. And the other thing that we use, as well as the HCPC's guidance on education and training, is the QAA benchmark statement. So the QAA, the Quality Assurance Agency, they have subject benchmark statements for all the subjects that you would study at university, and the biomedical science one was updated this year. So we align our accreditation criteria to that to make sure all of the right content is in there and you're being taught the right subject matter at the right level. So we do all of that work to make sure that all the stuff that you're studying is as it should be. Okay, so if you want to be a biomedical scientist, you need to have both of those bits. You need to have an accredited degree, or if you've done a non-accredited degree, you will have to do supplementary education to do the bits you've missed, and you need to have done the registration training portfolio. So if you finish an accredited degree, you can't go onto the register because you haven't had the lab training. So lots of people do that as their placement year. Some students graduate and then decide that's the career path for them, and then they choose to get a post in a hospital lab or a private lab where they can do the training. Okay, but you need both of those bits to be able to be registered with the HCPC. Once you've got both of those bits, we as the institute will say, yeah, we can see we've got both of those parts, and we issue what we call the Certificate of Competence. You have to have the IBMS Certificate of Competence to go onto the register. So once a week, my team send a pass list to the HCPC and say, these are all the people who've got both of those parts. They will be contacting you because they want to register now. And that's how you get onto the register. So, routes to registration then. So that's what registration is. It's something that people ask me about a lot, and they find it quite confusing and say, I think I want to do it, but I'm not quite sure how to do it. What's the best way to do it? Or if I didn't do it that way, can I then go back into the profession? So I'm going to talk you through the 4 routes to registration that we have. So I said that we are approved by the HCPC to deliver 4 programmes for routes to registration. So I'm going to take you through each one of those 4. Hopefully one will look familiar to you, and it will be a route into the profession to call yourself a biomedical scientist. So route 1 is probably the one you're most familiar with. So that would be, you would do your degree, you would do a placement year within that degree. Sometimes they're called sandwich because it's a choice, you can choose, it's optional. Sometimes they're integrated. So if it's an apprenticeship or if you've got an applied biomedical science programme, everybody on that route will do a placement year. So you would go out onto placement into a lab that's got approval from us to say that they can deliver the training, do the portfolio, and then go back and finish your final year. Some students are verified, that's the assessment that you would have before they go back because they've done everything in the portfolio. Some students go and finish final year, do the research project, finish off all the evidence, and then are verified at the end. So we've got a talk from Cherie about verification and what that looks like this afternoon for you as well. Once you've got both bits, you will get your Certificate of Competence and you can ask the HCPC if you can register. Route 2 is where you do an accredited degree, but it doesn't have a placement route in, or you didn't choose to do a placement at the time. So you've done all the right taught components, but you haven't had that lab experience and completed the portfolio. So again, quite a lot of students go into the profession this way. They didn't think about it at the time or didn't feel able to take the placement. The placements aren't paid normally. So some students say, I can't afford to do that. I need to do the degree and then get a job, and then I'll look for training positions. So you would do the degree that's accredited by the institute. You would then look for a job, either in a private lab or a clinical lab, and then you would get your training position, and then you would do the portfolio that way. Again, once both bits are finished, you've had your verification, we can issue the Certificate of Competence, and you can ask to register. Number 3, there are people who don't know about IBMS accreditation, and they don't do a degree that is accredited by the IBMS, and then they've got extra bits to do. So if the degree is accredited by us, like I said, we check the curriculum and make sure it's got everything in that it needs to have. If it's not accredited by the institute, it won't have the clinical specialisms in, because degrees that don't have accreditation don't teach them. Okay, so what you would need to do in that circumstance is you would need to send your degree, module information to us, have a degree assessment done, which we charge for, and then we tell you where the gaps are. So if you've got gaps because you did a degree that's not accredited by the institute, we'll say, well, that's okay, but you're missing med micro, you're missing cellular pathology, you're missing haematology and transfusion, whatever those areas are, and then you need to contact an accredited programme and say, can I come and study these modules with you? And again, pay to do those modules. So it takes longer and it's more expensive. We call those top-up modules whatever we identify that you need to do with supplementary education. Once you've got all of the top-up modules done and the registration training portfolio at work, then again we can issue the Certificate of Competence. And the last one, it's not really for students, I've just added it in for completeness. So we have an equivalence route for people who already work in the NHS. They've got a relevant degree and they've got a few years experience under their belt. So they're already working at the level of a biomedical scientist, but they're not on the register. So we have a route for them where they can get in and get on the register that way. So that's just for completeness, so you've got all 4. So important to note, so the Royal Society of Biology also accredit degree programmes. Your degree might have both. So some universities have both RSB and IBMS accreditation, and that's great. If your degree only has RSB and not IBMS, it doesn't have the right component parts in it for our registration process with the HCPC. So if it's RSB accredited only and it doesn't have the IBMS accreditation on it, you need to start asking questions, because you are going to have to pay to do a degree assessment and top-up modules, more likely than not. So just thought I'd mention it because RSB have only been accrediting courses for about 10 years. IBMS has been doing it for longer than that, and people don't know the difference. So they'll go to an open day and say, is the course accredited? And they'll say, yes, it is. And they go, brilliant, lovely, I'll do that degree. And then they realise later. Okay, so just to make sure that you're really clear. And if the degree only has RSB, like I said, it is likely that it's going to cost you more money. So it's useful to know. So if you can spread the word, I've got a piece of work to do to try and get that information out so that it's really clear to people. The worst thing in my job is people email me in the final year and go, I've done the wrong degree. I've just realised I'm going to have to pay a lot of money to do more modules. It's not very nice, is it? It's not a very nice position for them to be in. So the more people who know at 18 to just ask the questions, the better. So if you've got friends, colleagues, anybody thinking about going to uni, try and spread the word for us that a degree that's accredited by the Institute is the one to do if that's what they're thinking they'd like to do later. We do have 60 universities that have got IBMS accredited degrees, so it's not that there aren't many of them. That's over half of the degree programmes that are called biomedical science or biomedical sciences. So we've got over half of them. So there should be one near wherever you live. Okay, so you do the registration training portfolio. As I said, some people finish that during the placement year. They've done everything they need to do and they can have their assessment before they go back into the final year. What apprentices do is do their portfolio as part of the degree. So they are in the workplace and they go to university 1 day a week normally, or they have block release, but they're in the workplace all the time. So they're doing their portfolio work alongside studying for their degree. So we call that an integrated placement. Some people, as I said, complete the portfolio afterwards. Lots of people do that. Last year we issued about 1,267, I think it was, certificates of competence for people who've done the portfolio. Most of those are colleagues in work. So there's placement students and integrated students, but a lot of them are people who are in work already. To do the training for the portfolio, your lab has to have the right training approval. So it's normally NHS labs, but private labs do have training approval from us as well. So if you are going out on a placement year, if you want to work in industry and do research, great, absolutely fine. If you want to work in a lab to get your portfolio done, you need to ask if they've got lab training approval or ask your placement tutor at university to make sure that that's in place. Okay, so once you've done the portfolio, everything's finished, all the evidence is in, you then have an assessment, and that's called the verification. That person is checking what you've done, that you and your training manager and training officer have said that it's where it needs to be, it's got all the right bits in it, and they will check it through. The verifier says, yes, that's great, you've passed, well done, sends a report to us, the lab sends a report to us, and then we can issue the certificate to you. And as I said, it's only when you get that you can get your registration, and you've got to have the degree finished as well. So if you're doing top-up, it's doing top-up modules alongside doing the training. So I've concentrated a lot on being a biomedical scientist because that's kind of what my job is, to look after people who want to be a biomedical scientist, but it doesn't mean that that's all your degree will let you do. Biomedical science is a really good, solid science degree, and it can take you to lots of different places. So these are just some of the things that people have gone on to do that I've taught. So I taught in universities for over 20 years. So these are just some of the things that people have gone on to do. Students normally, when you speak to them, say, I like the labs. I don't like reading lectures, a bit dull. I don't like doing other things. I like the practicals. So these are the people that would go and work in the labs, different kinds of labs, but they go on to do different lab-based careers. Some people don't like the labs and say, I don't really want to do that. I want to do either further study, or I like being patient-facing, so I'd like to do something where I talk to people more than being in the back room and doing the practical work. So there's lots and lots of different careers that you can look at from doing a biomedical science degree. So an accredited degree by the IBMS doesn't mean that's the only career that you can follow. It doesn't mean you have to be a biomedical scientist at all. So once the IBMS has notified the candidate has passed the verification, everything is done, certificate of competence is issued, we tell the HCPC, they say, yes, that's fine, you go on the register, and off you go. You are a biomedical scientist. But as I've said, it's not what you have to do. You can choose lots of different things. So today is all about telling you what the different options are. If you're interested in being a biomedical scientist, that's great. We've got lots of talks to help with that. If you'd like to talk to some of the graduates who've gone on to do other things after they've finished their degree, we've got them here for you to talk to as well. So thank you very much for listening. I know that was a lot of information, but it is something people ask me a lot about, so I thought it was useful to go through for you. So if anybody's got any questions, I'm more than happy to answer them now. If you want to just catch me in the break, that's fine as well. So does anybody want to ask me anything before I hand over to our next speakers? Silence. It's like teaching again. I'm not scary, I'm quite nice. If you want to ask me anything in the break, then please do come and find me. So I'll invite our first speakers to come up. The slides should magically change over. Yeah, so I'll invite our next speakers up. So while they get organised, I'll introduce them to you. So do you want to come join on the stage? So we've got 3 speakers for the first talk. Come on in. So we've got Claire, who is a lecturer at York St John University for the Biomedical Science programme, and we've got Luke and Ella, who have both just done a placement year in NHS labs, and they've just gone back into their final year. Nearly finished now, aren't you? So yeah, so they're doing their final year. So they're going to talk to you about their experience about getting ready to go out on placement, what it's like on placement, and then coming back. So I will hand over to you guys.
Lovely, thank you ever so much, Sue. Hello everybody, good afternoon. Thank you ever so much for inviting us down here today. Like Sue's just said, we've come down in a little trio today. So we've come from York St John University, and I've brought Luke and I've brought Ella with me. So they're ideal to bring down to something like this, because I recognise that there's lots of different people in the room wanting to get lots of different levels of information out of a session like this. Luke and Ella have just spent this last year following their second year of study completing their trainee year. So they've just spent a year in the laboratories completing that training portfolio, going through that verification process, and they have literally just this week returned back for their final year of study. So everything is fresh in their mind, all those processing, the thinking that they did about this whole subject, did they want to go on the placement, was it for them, how to apply, etc., and what the placement and that portfolio experience was like. They're primed to ask lots of questions of later. It's all fresh in their mind, and they're absolutely brilliant, and I also think they're exceptionally brave for coming down and volunteering to speak at a big congress like this as well, so I'm exceptionally proud of them. But like I say, there's a lot of different people with a lot of different hopes and kind of requirements and questions for what they hope to gain for today. There'll be a big diversity in the group. Some of you will have completed a placement year, be in your final year of study, maybe even finished your final year of study, but maybe others of you are still thinking about that. What's that placement? Could it be for me? What does it look like? Who will I work with? What kind of tasks will I do? How do I get a placement in the first place? What's the application process like? If I apply and there's an interview, what kind of things can I be researching so that I can answer a question really well in an interview situation? And like I said, I'm only here very, very briefly. I'm about to hand over to these two because they've literally just done that process. So Luke, he is going to talk to you about those very, very early stages of that placement position. So for me, Luke was in my QT group when he entered in first year, and one of the very first conversations we had was that Luke knew straight away that he wanted to do a placement and that he'd like to go through the application process. So he knew from the get-go that he wanted to apply, and fingers crossed he'd get one of those placement positions. So he wanted to ask about how would he apply, when would he apply, what things should he look at for his interview, etc. He's also then going to talk to you about starting that placement, what were those early few weeks like, how did you settle in, etc. And then beginning that training portfolio, some kind of settling things, what can you expect in those first few weeks. And then Luke is going to hand straight over to Ella. Ella was slightly different. Ella wasn't sure at the very beginning if she wanted to do placement and go through into a biomedical science career. So Ella spent 2 years gathering all the information that she could, asking the questions of myself as the placement tutor. I tend to bring all the students that have just done placements back into the university and do some sessions with students so they can ask questions. So Ella's asked lots of questions of lots of other placement students. Is it for her? What does she need to do? And you had a great time when you did do it, didn't you? So Ella's got the other side of this. What did it look like during that year? Who did she work with? What kind of tasks was she involved with? What was a day in the life like? And that continuation of the training portfolio and that verification process. So you should get a nice kind of map of that whole transition process of going from thinking about it to actually completing a placement. So that's kind of everything for me, but please come and find us afterwards. But in the meantime, I'm going to hand over to Luke.
So hi everyone, I'm Luke and I'm a biomedical science student who just recently returned from his placement year at Scarborough and York Hospital. So I'm here today to talk to you a little bit about the application process and what that was like for me applying when I went on to go and do a placement year, and also what it may be like for you if you're starting a placement, and also what it was like also starting the portfolio. So as Claire said, when I started university I was pretty much dead set on that I wanted a placement year. This was because I knew that I wanted that all-important lab experience and work experience that employers would be looking for once you finish your degree and go off and get a job. So it was in second year that I registered my official interest in a placement year, and then I had to go and write a CV. So on the CV, instead of focusing mainly on the employment history, it was more about the skills I'd learned throughout first year and second year in the lab. And the ones that I could transfer to my placement year, and also other skills like communication skills and analytical skills. Luckily then I made it through to the interview stage, and then I was able to start preparing on the interview, and the feedback that I had from my interview was that I did quite well in these areas, and that was to read up about the HCPC, Healthcare Professional Council, and how their role embeds into the profession of a biomedical scientist, and also of course the IBMS, and how they as a professional body can help students and also professionals throughout their career. I then went on to have a look a little bit into the portfolio and what I'd actually be doing on the placement year, so looking at those modules, have a little bit of an understanding of them, then also get a brief understanding of the hospitals that I'll be applying for and their pathology departments, what different disciplines they do, and also the different types of samples they receive, and also who are their service users. And then I was trying to figure out which discipline I wanted to go into. So I had a little bit of an idea from my first and second year years, but I also looked into the other disciplines as well, because it's not always possible that you will get your first choice. So then luckily I managed to secure a placement, and then it was important that I then managed to keep focused on my studies. I didn't fall back on any second year modules. It was important to pass all the second year modules in order to keep the placement. It was then that I started a round of hepatitis B vaccinations, and this was actually, I was able to get on the campus university surgery and also apply for an enhanced DBS check, which again was organised via the uni and also funded by them. Now unfortunately, due to COVID at the time and the restrictions, I wasn't actually able to go on a direct on a lab visit. However, I'm sure now this is possible for you guys, and it's a good way to get familiarised with the lab that you'll be working in, and also meet the people that you'll be working with, and also find out where you're going to get coffee from, all the other important things like that. And then I was able to actually meet a student who had just finished their placement year at the hospital I was working at. So I was able to speak to them and get a good insight into what it was like working for them at the lab, and also have a look at their portfolio and see how they tackled some of their evidences and get some hints and tips off them. And one of the other things that they advised was it is going to be long days. It's essentially a 9 to 5 role, so make sure to buy some comfortable shoes. Okay, so skipping forward a bit to actually starting placement. So naturally with any job it's a little bit daunting. I had been in a university lab, I'd worked in there, but I've never actually been in an NHS diagnostic lab, so going in a little bit fish out of water, but I was able to use that first month or so to really find my feet, and this was I did in specimen reception mainly, and here this is where all the specimens and samples will be received, and this was a good place to start to understand the different types of samples that are received in the lab and where they will go off into different sections of the lab depending on the different tests that are going to be formed, and also figure out as well the different roles that are going on in the lab, such as the medical lab assistants and the associate practitioners and the of course biomedical scientists, and what their impact has on all the other roles in the lab, and also of course the wider healthcare and ultimately the patients. So then once I had this foundation, I was then able to go off into a bit further into the lab and start looking into the actual diagnostic testing of the samples and learn a bit more about the science behind them. And I wasn't pressured to know anything right away, as I had a bit of a misconception that I would be when I first started. This wasn't the case, and in fact the aspects that you learn at uni will definitely be a good foundation enough to set you on your way. And I was also made free to ask questions. And this was really good to deepen my understanding of the test that I was working on and the diagnostic testing, and how the results would be important to the clinicians. And then after this, I was able to then go off into all the different sections and gain a true experience of what it may be like if I was to go off and work as a biomedical scientist in the NHS. Okay, so now that I had this, I found my feet in the lab and I got a bit of an understanding of the testing, it was time to start thinking about putting some evidence together to give to my supervisor and ultimately the IBMS to show that I was competent enough to become a biomedical scientist. So I started this by actually just understanding the different modules that there is in the portfolio. So it comprises of 10 different modules, and all going to focus on different aspects of what is important to be a biomedical scientist, starting from just simply knowing what my responsibilities would be as a biomedical scientist, and then the different knowledge that I would be required to know, and also how this knowledge could be applied further into research and development and to also better the profession. And then also understanding the different standards of proficiency that I was required to meet, and also had these in my head as I was going through the lab and making sure to take notes where I thought I would hit in the SOPs, and then put this into a piece of evidence later on. And then the supervisory meetings that I'd have, they'd be then more focused actually around making sure I was keeping track of the portfolio, and if I had any worries or had any questions, this was a perfect time to ask for advice. If I was struggling for a bit of inspiration about how to tackle a piece of evidence, or if making sure I was even hitting the SOPs. And a lot of the time it wasn't actually that I wasn't hitting the SOPs, it was just getting it onto a piece of paper, and they were really good at being able to advise with this. So when I actually started the evidence, coming from university, I was naturally just more familiar with essays, so this is how I actually first tackled my evidences, but I quickly found that this could become a little bit boring, writing essays after essays. So to make it a little bit more interesting, you can do it in a lot of different ways, such as PowerPoints. You can also get witness statements off your colleagues, and you can also just annotate documents throughout the lab that you can pick up, such as charts or patient test results. Obviously, blank out any patient identifiers. And these are a much more actually efficient way to show that you can hit the SOPs without having to write 1,000 words on a piece of paper. And it's also a much better way to make it more interesting for myself, the reader, and making it a bit more unique and making it a bit more creative. Okay, thank you. I'm going to pass you on to Ella.
Hiya, I'm Ella. I've just finished my placement and I've come back to York St John for my third year. I'm just going to give you a bit more of an example of what you might be doing whilst you're on placement, and the different types of people that you're going to be working with, and how you end up going to complete your portfolio and your placement. So while you're on your placement, you are going to be learning a variety of different techniques. When you walk into any NHS pathology lab, you're going to see a lot of big, scary looking machines, and you're also going to see a lot of manual techniques being performed, which you will be learning whilst you're on your placement. You're going to be working with, as part of a multidisciplinary team, carrying out vital testing to aid in patient diagnosis, so you really are in the centre of that patient pathway. To do this, you're going to be liaising with different biomedical scientists, medical lab assistants, associate practitioners, and even consultants on a daily basis so that you can carry out your work. And whilst you're doing this, you are going to be collecting that evidence, as Luke said, and this is going to help you to complete your training portfolio. Just to give you a little bit of a scenario of what it might actually be like before you enter the lab, you might have patient A who comes into A&E with symptoms of sepsis, such as fever, rapid heart rate, dizziness. They might have some blood samples taken by an A&E nurse. They're given to a porter, they come up to the lab through specimen reception and up into the labs. And you might see that patient is then started on some broad spectrum antibiotics such as penicillin. But what you're actually going to be doing inside those labs, so these blood samples, they're going to be incubated on an analyzer that mimics body temperature. It's going to take a reading every 10 minutes, and it's going to detect any CO2 levels that are in the blood. This is going to mark the presence of any bacteria. Within 2 hours, that bottle might flag up positive. You and your supervisor are going to remove that bottle. You might set up a selection of agar, you might do a gram stain, and this is going to help to see what's going on, which bacteria is causing this infection. You are then going to take those results to the consultant, and that then allows them to make a more informed decision about what sort of treatment this patient might be needing that's going to be a bit more effective for them. And like I said, this can all happen within 2 hours of those samples hitting the lab, so you really are in that patient pathway. You might remember at Christmas there was a bit of an outbreak of strep throat, which was leading to some unfortunate fatalities. I was actually working in the labs at this point. It was we did really see the effects of this. We were working around the clock, sort of getting these tests done, making sure we were getting the results as soon as possible. We were liaising with GPs to make sure that these test results were coming in and that they were getting these antibiotics as soon as possible to prevent that infection from getting any worse. So it really does sort of remind you that these are real people, real tests, very real results. To give you a bit of an idea of who you're going to be working with, you might work with pharmacy consultants, you're going to be working with different wards, you might liaise with GP surgeries, sexual health clinics, your other pathology services such as biochemistry, histology, haematology, as well as your nurses, your midwives and your doctors. You really are in a big team. And to give you a little bit of an example of this, whilst I was on placement, I had the opportunity to go on a ward round with a consultant microbiologist as well as the pharmacy team, and we visited patients receiving broad spectrum antibiotic therapy, and we were able to assess if their current treatment plan was efficient enough or if any updated lab results meant that we could then narrow that spectrum down to something more effective. Whilst pharmacy were there, they were actually able to advise the consultant on the spot about any dose, frequency, risk factors or medication interactions that that patient might be facing. And that meant that that very same day, a brand new treatment plan could be implemented. And again, it's just providing the most effective care for the patient. As part of this, I was then able to write a reflection, and I was able to use that as part of my evidence in a portfolio. So as Luke said, it's very diverse, your portfolio. It doesn't have to just be essays. You can pull different things like this into it. So as I'd progressed through my placement, it came to the point of finishing my portfolio. So I collated 30 pieces of evidence, all from my different experiences, and I put it into that one portfolio. This then demonstrated my ability to conduct myself safely in any lab environment. It was signed off by the different staff members that I'd worked with to confirm that I was meeting those HCPC standards. And once that was done, I met with an external verifier who assessed that I was competent and then signed me off. And once you get to that point, you've really achieved a major milestone in your career to becoming a biomedical scientist. So you might be thinking, wow, that's a lot to take in. How am I going to learn all this? Everything is stepwise. You're not expected to go on your placement with all the knowledge. Everything that you're learning on your degree, you can take with you and build from there. You are going to be trained. You will never be left unsupervised, especially when you're working with a patient sample, and that's to keep everybody safe. The most important part, I would say, is ask a lot of questions. There's no stupid questions. Do your research. You might learn a methodology, a principle in the lab, and you want to go home, figure out what's behind it, why they're doing it, what you're seeing on those test results, and what that means for the patient. And in the short space of 9 months, you will be amazed at what you can learn. And again, another big piece of advice is just enjoy it, because it's going to give you an insight into a career that you might one day have. And yeah, it's just amazing. Thank you very much. We are happy to answer any questions, but if not, then come and find us and we'll answer later. Yeah.
So thank you very much. I'm going to make them stay here for a minute. Does anybody want to ask anything now of Ella and Luke and Claire, or do you want to just find them at the break and have a chat? Any burning questions? Cherie?
Fantastic. What are your plans now you've got a year back at university? What are your plans for moving into the laboratory after your degree? Maybe you could just let the students know perhaps how much easier it might be to walk into a job once you've finished your degree.
So when you are on your placement, you do kind of create a network. So they are going to remember you. I mean, we've both come out with sort of assistant jobs, so we are going to be kept in the loop if we do. We both want to go back to where we were, ideally do the biomedical science route. But it does just open up a bigger network for yourselves, like get on LinkedIn. Yeah.
Well done. Thank you very much. I was so keen for him to sit down. Sorry. I feel that you've done a really good job. I just feel like you've kind of edging away. But you're happy to stay. No, yes, okay, good.
It's just with the changes to the portfolio. Do you guys need to make any updates or change anything with the new portfolio coming in?
Have you had your verifications?
We have had, yes.
Yeah. So because they had their verifications before the 1st of September, they don't need to. So I did a talk this morning about the new portfolio. What was that yesterday? It was yesterday. It's all merging into one. So what we've done, we've agreed with the HCPC that as a bridging measure, anyone who's doing it this year and will be verified after the 1st of September, or anyone who did it last year and will be verified after the 1st of September when the new standards come in, we've got a series of questions to ask about the new things that have come in. So we've agreed with them that we'll use that as a bridging measure until everyone's coming through on the new one. So there are things around in the standards of proficiency, what's been expanded, what's new, what's been improved, increased, whatever. So we've got a list of questions that have gone to the verifiers and to any candidates that are waiting to say these are the things they're going to be asking you about. Just make sure you're ready when it comes to your verification for that. So everyone should know what they're doing. So they'll be aware of the new standards, but their evidences will map to the old 4.3. For 5, it's going to be online, it's a digital portfolio. What we've done there is we've mapped them for everybody. So in Module 1 it tells you what the standards are. So you select your 3 pieces to map against them. Any more? I'll look at the room this time instead of looking at them. Anybody want to ask anything else? No? All happy? Thank you very much, you did a brilliant job. Thank you. Well done. Right. And we're running ahead of schedule. That's always nice, isn't it? So what we're going to have next is another talk where we've got lots of student presenters, which is brilliant. So I'm really pleased that we've had lots of people who've said that they want to come and stand up in front of you all, tell you about their experiences. So Tahmina is going to be coming up with her group of students. So Tahmina works at the University of Salford. She's a member of IBMS Council. I know her very well. She's very nice as well, so ask her lots of questions. And Tahmina has created something that's called Portfolio Club. So for students who are going out onto placement, she's created this thing at university to help them to get ready to understand the portfolio and to be able to go out on placement and know lots about it before they go. So you've got 4 colleagues joining you. I'm delighted to say, do you want to come on up, get yourselves organised into a row? Yeah. And as if by magic, the slides are approved.
I talk a little bit quietly, so I'm just going to make sure I've got this. Can everyone hear me? Yeah. Okay. Thank you for introducing me, Sue. So I'm going to do a quick introduction of myself and sort of my background and introduce you to my students, and then they'll talk you through the rest of the slides. So I'm Tahmina. I'm a lecturer at the University of Salford and I'm the programme lead for the Biomedical Science degree apprenticeship. But I, like you, was a student studying biomedical science, and I actually went into becoming a biomedical scientist many years ago. I won't tell you how many years, but so yeah, I went into a biomedical scientist position. I went into first completing a placement, so I completed the Sandridge year while I completed my degree. Did a 12-month placement, and then I never left the trust where I did my placement, so I stayed there for a long time. And last year I came to the University of Salford as a lecturer, so I stepped into academia, and I'm also the IBMS placement tutor, so I look after, while I was in the labs, my last role was pathology training manager, so I did look after my own placement students, apprentices, as well as qualified staff members who were looking to progress in their career. So at the University of Salford, I created a portfolio club. I'm not going to talk to you too much about the portfolio because I know Sue's already covered it, so I'm going to skip past this slide. But before I do, I'm just going to introduce you to the students I've got here. So I've got Yamin, Joy, Heba and Syra, who have very kindly volunteered to speak to you guys today about their experience in the portfolio club. So thank you. So at the University of Salford, when I started here, I experienced from my last role as pathology training manager, I saw some of the gaps that we had when students were coming to join us on placements or even new graduates. And when I stepped into the university, I thought this is my chance to kind of bridge some of those gaps. We already had mentorship groups that were set up, so we do have research careers mentorship groups, as well as a group for supporting students to go into medicine and physician's associate. But the one I'm going to be focusing on today is the Biomedical Scientist Career Support Site, which is the one that I lead on, and it's very specific to biomedical scientists. So we have this scheme at the university. So every university will have a careers and enterprise team where you will get support with writing CVs, writing your job applications and getting support for preparing for interviews. But when it comes to a biomedical scientist position, we are looking for very unique things, and there are certain aspects that are very specific to a biomedical scientist career. So you can get some generic support at the university, but ideally what you want is someone who's sat on an interview panel before for taking on placement students and new graduates, so they're able to give you that tailored advice to becoming a biomedical scientist. So this scheme that we have at the university, we have an area on Teams where we advertise external events such as IBMS activities and things like the IBMS support hubs that many of you will be familiar with. But we also have tailored workshops to write CVs, job applications, and we also provide mock interview support as well. So we have sort of one-to-one interviews as well as group interviews. And we provide support for looking for work experience as well. So I'm going to introduce you to the Portfolio Club, which is another branch of the Biomedical Scientist Career Support Site. So many of our students are able to join the Biomedical Scientist Career Support Site, but the Portfolio Club is separate to that. And how did this come about? So last year when I stepped into my role in academia, I was already working with practice educators. You might have heard of them, but they're looking at really developing the biomedical science workforce and really developing pathology. And one of the studies that I was involved in, working with a practice educator, Martin Hicks, was looking at employability skills of students. So asking employers what skills and knowledge do they expect new graduates to be equipped with when they come into a biomedical scientist position. As part of that survey, we also asked a question to employers that if we were to start completing aspects of the registration portfolio at university, would they be willing to provide more placement opportunities? Because we know that there's a lack of placement opportunities, and students to be able to go out in a lab and really develop those skills that are required to work in the pathology lab. 91% of 43 employers actually responded to say that they'd be able to provide more placement opportunities if we were able to support students completing the portfolio at the university. So we launched this portfolio club as a trial in September last year, and yeah, I've had students that have joined the portfolio club. And what this involved was introducing them to the actual portfolio, so the HCPC standards of proficiency, as well as the modules that are in the portfolio. And every time we would meet, we would talk about one module per meeting. So for example, section 1, module 1, there's a lot in there about personal responsibility, equality and diversity and communication. So once I'd introduced the students to the portfolio, they got their head around the HCPC standards of proficiency and what they meant. And I then advised the students to download a reference copy of the portfolio. I don't think you can do that anymore though with the new portfolio because it's a digital portfolio. So it's okay. So Sue's just said we do have module guides, so that should help. So I asked the students to download a reference copy of the IBMS registration training portfolio. And I sent them away and I said to them, have a look at the portfolio and see what work you've done in your first and second year of the degree and how you can map some of the pieces of evidences from university to the portfolio. Once they'd completed that exercise, they came back on one of the dates listed on that flyer, and I had a look through their pieces of evidences and sort of agreed, yes, you could use this, or maybe that's not suitable, but actually if you build on it, then yeah, it would be a good piece of evidence to include in the portfolio. So I'm going to hand over to my students and they'll talk to you a little bit about what their experience was on the Portfolio Club in terms of learning about the portfolio requirements, their experience when it came to applying for placements, what their experience was when they submitted evidence and how the process worked with me reviewing that and giving them the feedback, as well as how they developed their awareness of HCPC registration and how that helped them then to prepare for interviews and then successfully securing a trainee biomedical scientist position. So first up I've got Yamin.
Thank you.
Thank you.
Hello everyone, it's a pleasure to stand here and speak in front of all of you. So at the beginning, first of all, I want to say my name is Yamin, obviously. I'm a trainee biomedical scientist at North Manchester General Hospital in biochemistry department. So first of all, I had no idea what the portfolio is about, why I even need this. But however, because I engaged in this club, I learned a lot, and there was plenty of new information that covers the importance of doing a portfolio to become a successful biomedical scientist. So this club really helped me to understand the structure more of the portfolio. So as you guys mentioned before, it separates into 2 different sections, 5 modules each, and submitting 3 pieces of evidence that meets the standard of proficiency. They call it SOP. And then taking this extra mile and taking the advantage of this club, I become super confident of myself when I did the placement applications. So as they say, hard work pays off. So there was tons of assignments to do. There was a regular session that she set us for us, as well as the regular lectures that we also have at the same time. Having all this is really a lot of pressure. So yeah, I'm really thankful and grateful for this opportunity to be here, because without this club and without the strong foundation that I gained from it, maybe I wouldn't be standing here. So I'm going to pass it to my colleague Cherie to expand more on this.
Thank you.
my name is Joy and I'm a student trainee biomedical scientist at Salford Royal in the Northern Kent Alliance. Thank you. So for my portfolio evidence, I was able to use a variety of coursework from my university. So for each piece of evidence that I used, I had to have an annotation justifying its use as a piece of evidence. So for example, in my first piece of evidence I used, I had a health and safety quiz from university in my first year. So I linked this one to SOP 15.2. This SOP is about having an awareness of the rules and regulations and policies on health and safety in the workplace. And a question in the quiz, which you can see here, it had a question about a specific rule that our university lab adheres to, which was my reasoning for justifying it to link it to the SOP. Another piece of evidence I used was a case study, which you can see here. It was a case study on diagnosing a patient using various results commonly seen in the haematology discipline. I linked the treatment part of this case study especially to SOP 13.8. This was because using the results of the full blood count, looking at the blood smear, looking at hematinics, all of these were absolutely essential to even diagnosing the patient and suggesting treatment for them, which is why I linked it to that specific SOP. Now, onto how I learned about HCPC registration and how I had an awareness of the standards. So in our first portfolio club session, Tahmina gave a very informative presentation on the pathways to HCPC registration. So very similar to the presentations we did at the beginning of today's session. Then in later sessions, we learned about what the portfolio actually entailed. For example, you needed 30 pieces of evidence, and you could use very different types of presentation or a poster, an essay, a witness statement, and many more things. And in one of the sessions, which you can see here, Tahmina even organized a specimen reception simulation, and through this session we were able to practically learn about standards of proficiency pertaining to specimen identification, because there were labels with patient details, identifiers on each sample. And we will also learn about how to keep accurate records, because we had to match what was on the request form to what was on the sample and see if it was correct and it was the correct patient. Now, for how we learn about HCPC standards, we had a certain module in our second year called Translational Research Skills, and we had certain assignments about where we had to learn about what the standards were. Then in our portfolio club sessions, we had to apply what those standards were, and we'd seen examples of them through Tahmina's own experience, and we had to look at our work and see where could we apply these standards, where could we link them, where could we say they were appropriate. Then Tahmina would set us assignments, like she mentioned earlier. We'd have to answer certain questions, which you can see here, questions that she made us for certain modules. Then we would hand in our work. After we submitted our work, she would give us feedback, and you can see she gave us comments here and comments. And she also provided physical comments, like writings on our work. After we submitted our work, we would get feedback, and then we would edit our work. We went through this process multiple times until our work was up to a good standard that we could submit it. And this was how I learned about HCPC standards and gained an awareness of them. Now I'll hand over to Heva.
Hello everyone, my name is Heva Toume, and I am truly honored to be here for the first time as a trainee biomedical scientist. In the next 2 minutes, I will share my journey from the University of Salford to securing a placement at Wythenshawe Hospital. It is a story of how support and preparation can pave the way to success. Let's start with the Portfolio Club at Salford. It was like a skill building hub where I gained valuable skills. It taught me a lot, especially how to collect evidence from my university experiences, as my colleague Joy was explained before, and as well as it taught me how to prepare for my placement interviews. After that, onto my path to Wythenshawe Hospital, it all began with an inviting interview email. The confidence I displayed during the interview was a direct result of the invaluable support and knowledge I gained from my involvement with the Portfolio Club, and as well from my participation in various IBMS support hub sessions like CV writing and preparation for interviews. These resources not only helped me, not only provided me with these relevant interview questions, but as well it helped me provide a deeper understanding of the process, and armed with this preparation, I was able to effectively showcase my skills and passion during the interview, and it paid off. I successfully secured the placement. To all students and future scientists, try to join hubs like Portfolio Club at your university. Use resources like the IBMS support sessions, build your skills and network, and be eager to learn everything, and from every chance you get. It really helps, trust me. I hope my story inspires you. Thanks for your listening, and now passing on to my beautiful colleague, Zaira.
Hi everyone, I'm Zaira from Salford. I'm in the haematology labs at Manchester Royal Infirmary. I had the honour to join Portfolio Club this year, and joining Portfolio Club really allowed me to understand more about the day-to-day life of a biomedical scientist. There's being a student sitting in a lecture and being told these are tests that are performed, but physically, like emotionally looking and thinking this is the patient's life in front of me, that is something that you'll only see when you're on placement or through some support events that we've done at the university. Although my degree provides immeasurable crucial knowledge, it was only through exploring the portfolio that I learned what was needed as a biomedical scientist and the sort of character that biomedical scientists that are registered carry. During my time in the Portfolio Club, it was through drafting evidences, making mistakes, receiving feedback, and then going back to research the standards again that I learned what it is truly expected of a BMS. From communication to well-being and professional relationships, I learnt that it's not just a degree that makes a biomedical scientist, it's continuous character development, learnings and CPD reflection. Understanding the standards of proficiency before I actually went on to placement equipped me to hit the ground running on my placement, because I knew already ways to demonstrate my learning through mind maps, questions, making posters, stuff like that, like we spoke about before. I know about the mandatory pieces of evidence, optional ones, like just going in with a bit more knowledge, so I wasn't like a little goldfish in the ocean when I went on to placement. But again, I'm only at this advantage because I joined the Portfolio Club 10 months ago. So a lot of my evidence was created using examples of my coursework, independent learning, and through reading the biomedical science practice books, or through attending the IBMS events, such as the ones that you'd get if you signed up as an E-student. They send you lots of support hubs and events, and joining them, there was particularly one at my university. There's a picture just there, the Manchester branch EDI event. So as you know, the new standards, they have an emphasis on EDI, such as recognising the impact of culture, equality and diversity on practice. This is something that's not taught in a degree, but it's more of a softer skill that you develop. I understand, after attending the event, I understand that, in summary, embracing equality and diversity in the field of biomedicine is crucial for fostering innovation, improving patient care, and addressing disparities to promote a fairer healthcare system, but not only for the patients, but for those who are training. So everyone has an equal right to train, equal right to being examined, and such as, like, now I'm in the lab myself, I'm seeing everyone. It's almost like a family setup, really, when you get to know everyone, because people have been there for 20, 15 years. Like, everyone sort of supports each other, and I've only been at my placement for 2 weeks, but I know I've been helped by a lot of the seniors and coasted as in my own development. I've only been there for 2 weeks. Joining the EDI event and a lot of the support hubs at the IBMS, I would urge any student to just sign up as a niche student, because it is just it's a wealth of information that not even if you're just going for a placement but more MLA type roles or anything, they definitely help within career development. Such as, just before I went into my interviews, I had a preparation with Tahmina and the Portfolio Club, and I was advised to research the trust that I was going to. So before I go into my interview, to know a bit of the background of the trust, there was a particular trust that I came across who signed an EDI strategy back in 2019. It's an agreement between the lab and the company and the trust to promote EDI within the workplace. I went into my interview, it's my second interview, and I'd asked the lab manager what their lab had done in support of this EDI strategy that they'd signed. The manager looked back at me with a blank response. And I was asked, how do you know about this strategy? And I said, I researched it. But I'd only know to research that by attending support hubs that the IBMS had done, or through the Portfolio Club and the work that Tahmina's done at Salford. It's so much, they're so helpful for students going into placement, or even just MLA type roles and stuff like that. A lot of the interview preparation, even we have support hubs on specialisms in biomedical sciences. If you're just trying to get your head around what is expected of a BMS, sign up as a e-student and have a look at some of the support hubs. Finally, some advice for placement students or those going into any sort of lab sort of roles. Be proactive in seeking learning opportunities. As I said, the IBMS offers a wealth of resources and events that can significantly enhance your skills and knowledge. Take advantage of training programs, workshops and mentorships to continuously learn and grow. Network within the organisation and build relationships with your colleagues, mentors and fellow placement students. Establish strong professional network. Everyone in the lab will be willing to help and support you, and you just have to be confident and be yourself and be friendly with everyone, and I've enjoyed it for the past 2 weeks. Take the initiative to volunteer for tasks or projects, such as like a lot of the placement students that have just previously come off on this round of their verifications. They're coming back as MLAs, as like bank shifts and stuff. Showcase your enthusiasm for learning and contributing to the organisation. Be proactive and request regular feedback from your mentors, even if you're still at university. Request feedback on some of your courseworks, and always look for ways to develop yourself as a future BMS. Document your experience. That's one thing that I'd tell anyone to do, is right now, whatever stage you're at, document where you're at, document the events, document today what you've been at, reflect on what you've learnt today. Maintain a record of your accomplishments, projects and the skills you've developed from now, during your placement and afterwards, even through graduation. And finally, good luck to all future placements. Stay positive, motivated and enthusiastic for your placement. There will be times where you're like, oh, this is not for me, or even if you go in as the MLA, you'll be like, no way, it's too much blood. But just stay enthusiastic, and remember your placement is a stepping stone towards a very successful career. It's not just a tick off the box qualification. You will walk out a complete different person. And make the most of this opportunity and use it to propel yourself towards a promising career.
All gather in case there are any questions. Brilliant, thank you so much. So all of our student presenters have been absolutely fantastic this afternoon, haven't they? So if you're thinking about doing a placement, do a lot of the things they're saying. Network, talk to people, get those skills, practice things, do a bit of research. They're all really, really good bits of advice for you to do. She's trying to take a photo. You need to move.
Oh. Yeah.
I'm just watching Sarah go.
All together.
Am I missing out?
Come to the stage. I will go to the left.
Okay.
Maybe.
Are we all in? Sorry, just bear with us.
We all like pictures.
So, any questions? Does anybody want to ask anything of our student colleagues? Yes?
Yes, just a quick one. After introducing the Portfolio Club, has there been a measurable uptake of people that have now got a training position?
Thank you, a really good question. 100% success rate. So I've only got a handful of students here to talk about their experience because I can't get everyone. here to talk because of the time. But yeah, what I will say is that those students who went above and beyond and took part in every extracurricular activity in the portfolio club, taking part in the interprofessional education events, attending all the mentorship workshops, everything, those students were the ones that were able to secure placements. I would say it was really competitive this year because of the fact that we had so many students that were taking part in these activities. To measure success, we've had employer feedback, so I'll be looking to publish some of this once I've got more data to work with, because we've used this as a trial, so we're going to be looking at developing this now and actually embedding it in, not just as a one-off, because we wanted to check first what the success was like. But we've had feedback from the employers saying that there was a clear distinction between those students who had taken part in Portfolio Club and the extracurricular activities and those who hadn't, just by answering questions. And the students, they knew their stuff before they went in. And these are fantastic bunch of students, but I would urge everyone to try and take up as many of these opportunities as possible and really put yourself out there to make sure you stand out. Employers have also said to me that it's going to be harder next year now to select the students if this is what we're going to be doing. We've set the bar high. So thank you. Any more questions?
Can I just say as well that some of the stuff that Tahmina's doing is really, really good, and what we've both said is we want everybody to be able to benefit from it. So academic colleagues will probably be in touch to say we're going to share some of this good practice, because they're all things that other people can replicate. Now that we can be online and we can do things on Zoom and on Teams, we'd really like to be able to offer things that we can host at the Institute that people like Tahmina can lead, but everybody can access from different universities. So we are going to work towards that. Sorry, there was a hand went up at the back, wasn't there? Who wanted to ask? Was she going shy? What did you want to ask?
Do you give help with verification prep?
That's one for the IBMS, isn't it?
Yeah, so when it comes to the verification, it will be the people in your workplace that would do that. So Cherie's going to talk about verifications next, but you'll have in the workplace, you'll have a training manager and a training officer. So everybody who goes on placement will have someone associated with them that's going to be helping them, and that's what we always advise at the Institute. So when you're coming towards the date, once you've got your date, practice, just take people around. Students use each other. So when I used to work with Claire does a lot with students buddying up and mentoring each other. So on the placement, you'll probably be with some fellow students, take each other around and do the lab tour bit and practice. So most of it is practice and gaining confidence, isn't it? So your workplace should help you with that to get ready for the verification, but a really good question.
I did want to add something about the Portfolio Club as well. So a couple of weeks ago we held an employer engagement event at the university, so we had a lot of our employees attend the event and give us feedback. And one of the questions we asked was that, given that the Portfolio Club has been really successful, would it be really helpful if we got all the students to sort of map the content that they're learning at university to the portfolio already? It just gives them that stepping stone. But actually, the feedback I got from employers was no, keep it as an extracurricular activity, because that's what helps placement providers select the students at interviews. Whereas if you were getting all the students to do the same thing, what's different? So again, this comes back to taking up those opportunities when they become available at the university, regardless of whether it's Portfolio Club or not, but whatever mentorship scheme you can join and whatever event you can join that kind of helps you develop these skills. It's not just about being in the lab as well, but it's things like Sarah mentioned earlier about soft skills, so interpersonal skills, teamworking, communication, leadership, all those kind of things. Even if you didn't want to become a biomedical scientist, these still contribute towards your development. Thank you.
Okay, I think we're perfectly on time. One more, yeah?
Do you recommend to do the portfolio during the placements or after finishing university?
Really good question. Placement is better because you're ready to register as soon as you graduate and you will walk into a job. So what everybody has said who started a placement is it's like a one-year interview. If you like them and they like you, they'll try and keep you. If you were looking for a job after graduation, everybody else from every university is as well. So there's 60 courses that have students finishing every year that have got IBMS accreditation, and you're all competing for the same jobs. So for the workplace, it's much easier for them to take someone who's had the training and is ready to then go on shifts and that kind of thing. So they prefer students with placements, but they are competitive to get. So.
What about if you've got masters?
You still need to have the right degree, so the BSc is the important bit. So master's necessarily a specialist normally. So if you have an IBMS accredited master's but not an accredited BSc, you'll probably still have gaps. So the master's doesn't get you on the register, only the portfolio gets you on the register. Okay, we're ready to move on to our next one. And by the way, Syra, if you don't want to be a scientist, you should go into marketing. You've done a brilliant job at selling new students. Thank you. Okay, our last speaker in this little session before we have a break, you can stretch your legs, go and have a wander, go and get a drink, is Cherie. So Cherie, if you want to come and join me. So Cherie is a microbiologist by trade, aren't you? You work in micro.
Absolutely.
And Cherie's got really interesting perspectives on the verification process, having been verified yourself, is an active verifier and also teaches at a local university as well, so talks to students before their placements and things as well. So Cherie's going to talk to you about that experience of the verification. So that's the assessment that you get at the end of the portfolio.
Hi everyone, thank you Sue. I'd just like to plug a couple of hashtags there. Please do tweet about today, hashtag IBMS Congress 2023. You've heard the word networking throughout the session so far today. Networking is absolutely key. And that's perhaps where IBMS Chat comes in. This is an IBMS initiative, meets on the first Wednesday of every month. It's on X, or Twitter as most of us know it as. And it's a fantastic opportunity to network with like-minded professionals like yourself, from students to laboratory professionals, lecturers. We once had somebody from overseas joining in on the chat, so really, really good opportunity there. So just a couple of hashtags for you. So, Tahmina wasn't too happy about dropping her how should we say, time in years as to when her verification was. I will tell you, this was me 6 years ago. So this is just an excerpt from an article I wrote for the IBMS quite recently, and I'm just going to read that out to you. So just think about how you can relate to what I'm saying. Maybe in your examinations you might have done recently at university, or you've got exams to come. Heart pounding, stomach churning, palms sweating. The fight or flight response. It's the day of my IBMS registration training portfolio verification, and I'm so nervous. I know my stuff. I've worked hard to compile my evidence and map it against the necessary HCPC standards of proficiency. I've rehearsed and rehearsed my laboratory tour. I'm just so nervous. I just hope I can keep my nerves in check and get through my verification. Can we relate to that? Exams, maybe interviews? Yeah, absolutely. And I can as well. As a verifier, I absolutely know what it's like to be sitting in that position, as do many other verifiers. So yes, it might be a bit of a daunting process, but it really needn't be. And my talk today over the next 20 minutes, that reminds me I forgot to start the timer, but I'm sure Sue will tell me to stop talking when I need to. I hope to demystify a little bit of the scariness of a verification, and you might start thinking exams, but it's really not. It's absolutely a two-way process. So we've heard a little bit about where verification falls into the process of becoming a registered biomedical scientist. So you need the right academic qualifications. That might be top-ups, or it might be an accredited IBMS accredited degree. And this might be ongoing. So you might be doing your verification during your placement year, or it may well be in the workplace after your degree. You've got your clinical laboratory training, and this is in an IBMS approved training laboratory. And you've got the IBMS registration training portfolio. And then you've got verification. So you arrive at verification day. And whether this takes place virtually, because of course the IBMS offer this process virtually now as well, or whether it's face-to-face, it will follow loosely the same sort of format. So you'll have introductions. So this will be the external verifier. This will be your training officer. So you heard from some of the students who mentioned their training officers. And this will be, of course, with yourself as the candidate. There will then be an informal interview with the candidate and training officer, the portfolio verification itself, and I'll come to that later as to whether that takes place there and then on that day or beforehand if that's virtually, the tour of the laboratory, an optional meeting between the verifier and the training officer, and then of course the feedback and the outcome at the end of the verification. So introductions. For myself, I like to use this as reassurance. I'll introduce myself to the candidate and to the training officer. I'll try to set the scene for the day, so a little bit about the structure as to what to expect. I'll try to keep things light-hearted. So have you got a bottle of water with you, just in case you need to take a little sip as you're going along? And I'll say about taking notes. So I'm very old school, I like to scribble things along as I'm going, and that just helps me as the verifier compile my report at the end. So I'll say, don't worry if I'm not giving eye contact, it's absolutely fine. And that there'll be question and answer throughout. So I like it to be very much a two-way process in terms of dialogue. And I find that if it becomes a little bit like that, hopefully that reassuring process means that I absolutely get the best out of the candidate on the day. Because of course we're just spending a couple of hours together. So you've noticed that I've put interview in inverted commas, and it is termed an interview, but I like to just phrase it as more of a two colleagues sitting in a room or sitting behind a PC, getting to know each other. I just want to hear all about your journey, your training experience as a candidate. Of course, I've got a couple of questions that I need to ask in order to satisfy the IBMS verifier report, but it's more an icebreaker. Again, you've got that word there, reassurance. So really, I do truly want to get the best out of the candidate on the day, and ultimately, we want you to pass if you're ready. So some of the questions are necessary. Some of them I'll ask, and I'll ask them every single time, and that's just to satisfy me as the verifier that you absolutely do meet the necessary HCPC standards of proficiency, but also because I'm a professional as well, I'm absolutely interested in what you're doing. So I'll say, what's your favourite piece of evidence that you completed? What was the hardest piece of evidence, and how did you maybe overcome that struggle to compile that piece of evidence? I'll ask about who chose the pieces of evidence. Was it a little bit from university? Was it a little bit from the training officer? A bit of a two-way process. You had this niche idea and it was embedded. The induction process in your workplace, because of course I did mention that these laboratories, they must be IBMS approved to provide the high quality training that the Institute require for you to become biomedical scientists. So I'm going to probe a little bit about the laboratory and just ask about that training process there. I'll also ask about the access to study space and resources, because again, that all feeds into the support that you're provided during your placement or during your training experience. We then move on to the portfolio verification. Now, if this portfolio verification is face-to-face, so I will travel to a laboratory, then this will take place largely on the day. It does say approximately 90 minutes, but a lot of the verifications at the moment are virtually, and this is fantastic because it means if a student in Manchester asks for a verification and I'm based in Essex, then yeah, no worries, I can do that. I don't need a whole day off work. I can just set aside the time, receive the portfolio about a week beforehand, and do that in my own personal time, and I find that fits in quite nicely. So this is portfolio scrutiny, and the new version 5.0 of the portfolio should make it a little bit easier for verifiers. But in this process, what I'm doing is truly looking to see, do you meet the necessary HCPC standards of proficiency? I'll also think about some areas of strength. So in the verifier's report, I'm asked to comment on some areas of best practice, and I might want to take those away to some of the students and some of the trainees that I work with in the laboratory in which I do. And I might think about some areas of improvement. And this doesn't necessarily mean the portfolio is a fail, it might just mean a little bit of feedback for next time, for future candidates, or future information for yourself as the candidate that you can go on to and build upon. We then move on to the laboratory tour. And again, we've got this in two different ways. So face-to-face on site, I'll physically be walking around with the candidate through the areas of the laboratory in which they've trained in, covering facilities, equipment, environment, and basic knowledge. So this is you practicing as a biomedical scientist on day one of your career, and can you do this safely and within the HCPC standards of proficiency? Again, I'll take notes, and this really does help me in terms of compiling my verifier report.
And I'll also look at the training environment and different notice boards. So I will ask questions throughout, and this is actively encouraged, and I find it does allow for that dialogue, and after a while you'll find that the candidate does relax a little bit. And again, some questions that I always like to ask: security. So you've swiped in to come to work and someone's trying to duck in behind you and you don't know who they are. Can you practice safely and be able to say, sorry, excuse me, can I just ask who you are? Oh yeah, I forgot my badge, blah, blah, blah. You know, can you protect patient confidentiality and adhere to the security of the laboratory setting? I'll ask about health and safety. So working with chemicals, hand washing. It might sound really basic, but do you know when to wash your hands? Do you know how to handle a spillage? And what about a high-risk sample? You may not necessarily know precisely the intricacies of handling such a sample, but you know who to ask, and that's the main thing. Maintaining equipment. So perhaps you've learned to use a particular analyzer. What do you do to know that the analyzer is working as it should? And hopefully on your degrees you're learning a little bit about quality control. So I might ask a little question about, do you run any quality controls to know the machine is working as it should? And I might ask about pre-analytical checks, and you've learned a little bit about that today. So that's as basic as, is the sample labelled correctly? Is it the right sample? There's then an opportunity for myself as the verifier to meet with the training officer, either to discuss any areas of best practice or any areas of improvement. Perhaps I might like to raise an issue or a concern. But of course I did say this is optional, so if it's not required, we can then progress to the outcome. And what I'll say here is, when I do verifications, I always like to give the candidate their outcome on a one-to-one basis. And I can promise you, in that moment, when I tell the candidate that they've passed, I absolutely feel as high as you feel in that moment. To be able to tell a candidate they've passed and they can progress to their next step of their career is so rewarding. So we've got two outcomes, as you can see: a successful verification or a pass, or an unsuccessful or a fail. But that doesn't mean things stop there. It's very much a dialogue, a conversation between the training officer, between the institute, to find out where the gaps are. It might mean some additional evidence is required, or it might mean a full verification is required. But it's absolutely not slamming the door on progression. So feedback is so important. And you heard from one of the students before about CPD. So CPD is so important for myself as a verifier and a HCPC registered biomedical scientist, but the verification itself is CPD for yourselves as the candidate, for your training officer, and for myself as the verifier. So we're all looking to gain from this process. I'll comment on some of the general comments of the portfolio. Was it nicely laid out? Was it easy to read? Could I clearly see where the standards of proficiency have been met? I'll list some of the areas of strength, so particular pieces of evidence that I really liked, and maybe some that needed a little bit more improvement or refinement for future candidates, but still absolutely met the standards of proficiency. I'll comment a little bit about the tour and the content, and this is largely useful for the training officer and future candidates that come along. And then I'll be very clear about what happens next, because of course you're all itching to get on the register, but it's knowing what happens next and how can I do that. So you've heard about the certificate of competence today. So you've got a successful verification or a pass, the verifier's report, and that's what I will compile and send to the IBMS within 7 working days. Laboratory feedback, so this is from the training laboratory. And then you've got the academic qualifications, and this might be in real time. For example, if you're already working in the workplace and the degree is completed, or this might well be another year after your placement if it's a placement that you're undertaking. You're then issued with a certificate of competence, and then you can look at HCPC registration. So it's a little bit of a whistle-stop tour about verification, and I know we've got a break coming up, so I'm more than happy to take any questions, but I am around for the rest of the day, and I'll be sat at the front in the striped shirt, so please do come and approach me. Please do use the hashtags. Twitter is, or X, is really useful and has been really useful for myself as I've progressed throughout my career. So if you're looking to network with any, or you think of a question later on when you're catching the coach home, just drop a tweet in the IBMS there, and hopefully we can answer any of your questions. Thank you.
Thank you very much. Does anyone have any questions they'd like to ask Cherie before we break? Yeah, Joy?
What are general things that you've noticed as a common pattern, or if there's a common pattern in the verifications that have been successful? Was there anything that particularly surprised you in your years of verifying?
So I'll just repeat the question. So Joy just asked, is there anything different, unique, special about the ones that are successful at verification?
For me, it's where the standards of proficiency have been clearly hit. And I know with version 5.0 that will be a little bit easier for me as a verifier to depict. Not necessarily spoon feeding me, but making all of the evidence available and clear. So evidence that clearly says this meets standard blah, 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 blah. Feedback, where feedback is absolutely clear. And this might be as simple as a different coloured pen. And the training officer might say, but what about this? And then the candidate's written underneath, oh, okay, didn't think about that, and here's my answer. And I know when I was training, I wanted all of my evidence pristine. I didn't want any handwriting. If I needed to print it again, I didn't want to make a typo. But this is what we want to see. We want to see that dialogue process between yourself as the candidate or the student or the trainee biomedical scientist and the training officer, so that the training officer can give appropriate feedback, but you've absolutely got a proactive approach to learning and taking on board feedback and then using that. So variety, feedback, annotation. So we've heard about a different type of evidence, so essays, but we want to move away from essays. We want to move away from witness statements. So perhaps doing a piece of work and then lifting it up by annotating it. And then for me as a verifier, although I've got the chat to clearly understand that it's original and that it's your own work, annotation really helps me to see that it's your own work that you've produced in the laboratory and it's not taken from a textbook. So I can really see your understanding. So I suppose those are the main things. Sue, is there anything?
Yeah, no,
or
I agree.
Tahmina, anything you'd want to add as a verifier?
I want to know how the new digital portfolio is coming along. Have you got any ideas of kind of evidences that we can be using that to our advantage? I've got a few. I just wondered whether there's anything you'd like to share with students here. Things that they can be thinking about?
So I'll say one piece of evidence that I did on a very recent verification, and I hope it will fit in nicely with the uplifted HCPC standards of proficiency, but also the new 5.0 portfolio. And this was regarding equality and diversity. And this particular student had absolutely lived and breathed equality and diversity. And they listed some of the things in the laboratory that might mean they need to consider how they work with different colleagues. And it was things as basic as visual, so wearing spectacles. So what sort of allowances might they, as an individual, so it's really, really personal, what might they need to make for their colleagues? What about a colleague that is in a wheelchair? But what about a colleague that has autism? Or some of the characteristics that maybe we don't always think about. So I could absolutely see that they'd met those standards and the new standards actually, because they showed how they applied it in day-to-day practice. So that's a piece of evidence that I'll definitely be looking out for and advising any students that I teach in the future.
Yeah, I would agree. It's about applying it to what you do. So it's about something that you're talking about how are you using that in your practice, because the standards are all about demonstrating something, not just knowing about it. I think there's one more.
I'm interested in the emphasis that you have put on moving away from the essay types and stuff and doing original. How far can you take it? For example, if I have demonstrated and taken a video of myself talking to a colleague over a topic, could I have a link of a little video, or is it taking it too far?
Yeah, no, so the digital portfolio can accept lots of different file types and videos are okay. What we said is just think about the verifier. So they've got 90 minutes to look at the whole portfolio. So if you video a half an hour conversation, they're not going to be able to watch it all. So using it, if you were to do a little vlog, something like that, tell us that you've done something, absolutely fine. But just think about the time it will take someone to get through. So the more innovative people can be, the better. Each module will now have a mandatory piece, so we will tell you what that piece of evidence needs to be. For the other two, you choose. You can be as inventive as you like, and the new system will accept lots of different file types.
I'd add that I would love that, as I say, but keep it brief. As a verifier who tries to do as many verifications as I can that meets in, my personal life and my professional life, I see a lot of evidence. Some it's very difficult to think outside of the box, but if you can provide something that's original and unique, then absolutely, because I might not have seen it before, and it just keeps me really engaged as well.
For this part of the presentations, we've got 4 graduates who work in a pathology discipline. So when you're doing your degree, you'll have specific modules on the clinical specialisms. So we've got 4 talks, they're just 10 minutes each, and again we're going to have a break after that so you can go and ask those people questions if you're interested in one of the subject areas. So the first one is Hussain. Hussain, please come on up. So Hussain graduated 5 years ago. Having done a placement, and he works in haematology. So Hussain's going to talk to you about working in the haematology lab in the NHS.
Hi, good afternoon everyone. Hope you're alright. So my name is Hussain. I'm a biomedical scientist working in haematology blood transfusion at Barnsley Hospital. I'm going to give you a little bit of a rundown of some of the tests we do, some of the disorders we're focused on in haematology blood transfusion, and then we've got a little interesting case study just to illustrate everything and tie it nicely together. So I work in a smallish laboratory. It's a general hospital, and even though it's just smallish, we get about 2,000 samples a day in haematology alone. And these come from within the hospital, so our emergency department or all the different wards. But they also come externally, so all the GP surgeries that surround us. And it can also come from nurses that are going to patients' houses maybe to bleed them if they're not able to get to the hospital. Because it's a general hospital, I get to work in all the different disciplines that fall under haematology blood transfusion. So you've got haematology to do with analyzers and even looking down the microscope potentially. You've got coagulation to do with making sure patients can clot properly. Then you've got blood transfusion as well if they need products potentially. At the end of the day, part of being a BMS is all about ensuring that whoever's requested those tests, they can get those results back, especially if they need them. So what we're really focused on in haematology is blood cells that have been made in the bone marrow. So I've got 3 of the main ones here for you. So we've got platelets, which are essential for clotting the blood when maybe a patient's had an injury. We've got white blood cells. These are the cells that rise up to fight against infections for yourself. Then you've got red blood cells, quite selfless. They're packed full of something called hemoglobin. It carries oxygen around to your organs that might need it. Some patients say that they've had a particularly nasty bleed and they need to increase their red blood cell count or some hemoglobin. We might be able to support this in the way of a transfusion. And this is the analyzer we use to get some information about the size of these blood cells by firing a bit of light at them, and we can also combine this with some staining to figure out what the different blood cells are. The other thing we look at is blood clotting, so whether a patient, if they get an injury, they can actually clot properly. And we can actually do this outside the body, so we've got a little diagram here to illustrate this. We'll add a bit of the patient's spun blood to a little cuvette, and a metal ball will move side to side. And when we add different reagents, we're actually able to start the clotting process outside the body. And we'll actually measure that time it takes for that ball to stop moving, and that's the time to clot. It's a very important test looking for blood clotting because there's a lot of patients on things called anticoagulants. You might have heard them more commonly known as blood thinners. It's important that we make sure these patients are dosed correctly so they're not receiving too little, not too much. We also have to think about patients with bleeding disorders. So in the clotting process, there's key components that some patients might be missing, and it means that they're unable to clot properly. So for these patients, actually, we can look at the missing jigsaw piece and we could potentially replace it in the form of a drug. And then looking down the microscope to support some of our analyzer results, I've just got some of the things we might focus on. So one of the things we look at is leukemias. These are cancers originating in the bone marrow, so cancers of the blood. And these are things that they shouldn't be in the bone marrow or the blood to begin with, or sometimes they've actually left the bone marrow when they were too immature to do so. Another thing is we look at patients who have inherited different blood cell disorders, maybe from parents. So I'm sure you've all heard of sickle cell disease. Blood cells should usually be nice and round, but actually you can look here and you can see how elongated and sharp it is. So if this was a patient that we didn't know anything about, or first presentation, we'd have to do further tests to confirm whether this is sickle cell disease or not. And then we move on to the more uncommon things. So here on the left we've actually got a picture of neutrophils. These are white blood cells that fight bacterial infections for you. And if you look carefully, you'll see some rod-like inclusions there in those neutrophils. And they're actually bacteria, so this was a patient we had with overwhelming infection. Seeing something like this obviously can prompt, for them to have antibiotics or, something like that. And then we get into the really exotic things, not things we'll see on a daily basis, but we're talking about blood parasites. So on the left there, you've got what's called microfilaria. It's essentially a bloodworm. And you can see how big that is, even though you're looking down the microscope, because if you try to look at those individual blood cells, you can see they're all clumped together. So that can give you an idea of how big it is actually compared to the other image. And then on the right, we've got a picture of some malarial parasites. We can use a lot of interesting features about these parasites to figure out what species we're looking at, because this can affect the treatment of the patient. So even the fact that there's two of them in the same blood cell might be one little part of the puzzle for us. So I've given you a little introduction to haematology, and now I just want to run you through an interesting case where we have to use everything to come to the conclusion. So a midwife sent us a sample in the labs, and they're concerned that a baby had yellowing skin and a bit of yellowing in the eyes. They're concerned about something called jaundice. So red blood cells, they break down after 120 days, a perfectly normal process. And we try to recycle as much as they can, so things like iron. Another natural product that's made from this is called bilirubin. And we can usually get cleared of it, but if this process is happening too quickly, or in a baby you're unable to clear it properly, it can build up and it can become quite dangerous. Unfortunately, it might cross the blood-brain barrier in a baby, and it can lead to permanent brain damage. So here's a little graph to illustrate that you can see the baby's result is 544, and it's so high that it goes above this orange line for exchange transfusion. It's so high, and the risk for this patient is so high that we're considering taking blood out of baby along with the bilirubin and actually giving them transfused donor blood, all with the efforts to reduce this bilirubin as soon as we can. It's essential that we get to the bottom of this as quickly as possible, because this is one of the implications it might have. So one of the things we think about is this baby's just been born. Is there something maybe to do with their own immune system or mum's immune system that's causing these blood cells to be broken down too quickly and causing all that bilirubin to be released? So actually we look here at something called hemolytic disease of the fetus and newborn. And unfortunately sometimes mum's immune system can recognise that baby's blood cells aren't her own and can make antibodies against it and cause these red blood cells to be destroyed. So if you focus on this thing called DAT down here, you'll see that when antibodies are bound to these red cells, they're unfortunately too big to go through the well. So the fact that it's negative, and you can see I've illustrated this by scoring through these red lines, that isn't the case here, so we exclude this amongst the other things we looked at. Finally, we start getting an idea into actually what this patient has. So this is a red blood cell cytogram. It gives us really good information into the size of a blood cell and how much hemoglobin it has. So I talked about how that's the oxygen carrying thing. Can you guys spot the difference between the normal cytogram on the left and the cytogram on the right? It's that cluster of red blood cells that have shifted right. And it's this point BMSs and myself on my night shift decided it's time to make a blood film. So normal red blood cells, they're round, they're biconcave, they have a little dip in the middle, and as millions of them travel through your blood vessel, it helps them squeeze past them. But what you'll see, and I've highlighted here in red for you, there's a lot of red blood cells that are perfectly round. Cleverly, it's been called the name spherocytes. And actually, they don't have any like little paleness in the middle. They're perfectly round. And with the sheer amount in here, we actually find out this patient's got something called hereditary spherocytosis. And actually, part of the red blood cell membrane, all these proteins that relate to structure and keeping it strong, some of these might be missing, and that's causing part of the membrane to be lost, and that's why they become perfectly round. The fact that we're able to identify this means, we've got a diagnosis and we're able to treat the patient properly. So yeah, the patient was okay in the end, and we continue to monitor them to this day. Thank you. Any questions?
Anybody want to ask anything, or shall we just go through the talks and then you can come and ask questions afterwards? Maybe we'll do that. We'll keep it moving. Thank you, Hussain. So our next speaker is Chris. Chris is also a graduate of mine years ago. And Chris is a histology person, so he works in cellular pathology. So Chris is going to do the same thing, tell you about what his workplace is like, what kind of things he does, and then we'll move on to 2 other disciplines as well. Thank you, Chris.
Hi, so I'm Chris and I'm a specialist biomedical scientist in histology. So what is histology? It's the study of the pathology of cells and tissues. We do this by producing a diagnosis based on the microscopic evaluation of very thin slices of tissue mounted on glass slides. We call these tissue sections. Tissue on slides can only be visualised using a microscope following a process known as staining. So we use various dyes and chemicals basically to give the tissue colour. And many diseases, including infection, inflammation, and even cancer, can be diagnosed by looking at the cell morphology. When we say cell morphology, we basically mean the arrangement of cells and tissues within the organs that we're looking at. So the first process that happens within the lab is specimen dissection. So we receive a wide variety of specimens all over the hospital and even from GP surgeries, ranging from tiny endoscopic biopsies all the way up to whole segments of colon, breast mastectomies, and larger specimens such as those. The first thing that we need to do is we need to describe and measure the sample. Occasionally we'll need to open that up so that formalin fixation can happen. This essentially preserves the tissue in its most lifelike state as possible. And then usually it's the pathologist's job to then dissect the specimen. So they look at the specimen and select the most appropriate pieces of tissue to allow for diagnosis. So we'll follow the path of a specimen through a histology lab. So the first thing that happens is processing. The tissue here moves through a sequence of reagents and it's essentially dehydrated. So the water is removed and it's steadily replaced by molten paraffin wax. When this wax cools, it solidifies, resulting in a very firm piece of tissue. These are the optimal conditions for microtomy or producing a tissue section. We then move on to embedding. So the tissue is orientated in a mould containing molten paraffin wax. The idea here is to manipulate the tissue so that you've got the widest surface area facing down, so that when you do create your tissue section, you're going to see the full picture. The mould is then placed on a cold plate to solidify, and you can see here on the far right what we would call a tissue block. So that's solidified molten wax with the tissue suspended in the middle. Moving on to microtomy. So here we use a specialised piece of equipment known as a microtome to produce our tissue sections. So you can see here is where you would put your tissue block, and there would be a very sharp blade in this part here, and every time you turn this handle, the chuck moves up and down, but it also advances towards the very sharp blade a set distance. In the histology lab we're working in microns, so 1 micron is 1,000th of a millimetre, so we're dealing with very thin pieces of tissue here. So as you might expect, a high level of skill and manual dexterity is required to use it effectively, from being able to decide how far into the tissue to cut so that you've got the full picture, to being able to carefully manipulate these ribbons of tissue sections and get them across onto a glass slide for staining. So moving on to automated staining. All tissue that receives in the histology lab receives a H&E stain. So this stands for hematoxylin and eosin. The hematoxylin is a nuclear stain, so it stains cell nuclei purpley blue, and eosin is a cytoplasmic stain, so it stains the connective tissue various shades of pink. We've seen this phrase morphological before. It's a morphological stain, which essentially, again, it allows you to see the structure and the arrangement of the cells within the tissue, allowing any inflammation, degeneration and pathological changes to be diagnosed. So here is the hematoxylin and eosin stain. You can see all the little purple dots are the cell nuclei, and the various shades of pink represent the connective tissue holding it all together. With it being a morphological stain, you can see the arrangement of these cells in complex structures here. So this is a piece of colon mucosa, and you can see all these little circles at the glands, and the larger structure of the crypts within the colon. And any pathological change could be quite easily seen. So for example, cancer, the hallmarks here would be nuclear change, loss of tissue structure, things like that can be seen just using the H&E stain. Quality is a very important concept within any NHS pathology laboratory. Here we can see section quality could greatly affect a pathologist's ability to produce a diagnosis. We've got things like folds in the tissue, holes from rough trimming when you're using the microtome. This shows how basically any small error in microtomy or any of the other processes could result in quite a large problem for the pathologist. Moving on to ancillary testing. So this would refer to any testing that happens alongside the H&E stain to support the pathologist in making their diagnosis. So we've got special stains. This refers to any staining that isn't a H&E essentially, and it covers a wide variety of methods that can be used to visualize specific tissue structures or microorganisms, etc. We are seeing automation increase in all the laboratories, in NHS laboratories, but most labs still perform these special stains manually. So we've got some along the bottom there. We've got the little black flecks here would be fungal hyphae in fungal infection using the Grocott stain. Further along you've got this one here, shows melanin using the Masson-Fontan stain, and it would help the pathologist to be able to categorise malignant melanomas. Immunohistochemistry is also used, and this uses the antibody-antigen interaction to allow specific proteins to be targeted and stained. This is essential in categorising tumour types or primary sites, because various proteins are only common in certain types of tumour. This is always developing alongside advances in molecular pathology, the detection of specific gene mutations being vitally important in order to select the right treatment for the patient. Which leads us on to molecular pathology. This is a fast evolving discipline based on the diagnosis of disease through the examination of genetic material and molecular abnormalities. So it's actually the specific mutations within the DNA and RNA that's being targeted using this technique. These proteins are often involved in genes to do with DNA repair, tumour suppression, so any mutation would lead to a loss of function, and that would then lead to uncontrolled cell growth, which is a common hallmark of cancer. The techniques involved here range from fluorescent in situ hybridization, polymerase chain reaction to whole genome sequencing, and by using molecular pathology we can have a personalised approach to treatment, so you can select the most efficient treatment to that specific patient's cancer genetic makeup. The future of histology. So one of the areas that's evolving currently in histology is digital pathology. This involves the scanning of the glass slide to create a digital image of what's on it, which is then viewed on a HD monitor as opposed to a microscope. The benefits here involve patient benefits, so it allows instant access to expert second opinions anywhere in the world. It's much easier to share a digital image with someone in Australia than it is to send the slides over there. It benefits the pathologists also. It allows them greater control over their workload and access to accurate measuring tools. And it's also paving the way for artificial intelligence. So by feeding AI these images, it learns, and then it's able to screen out any normal cases, just leaving the more complicated cases for the pathologists to look at. And finally, we're seeing more expert and advanced BMS roles growing in histology. All of these are offered by the IBMS, certain portfolios such as the Diploma of Expert Practice in Specimen Dissection, so that allows BMSs to train and then be able to select the tissue for diagnosis. You've got the Higher Specialist Diploma, which is a master's equivalent qualification. It essentially requires you to be an expert in all things, whichever discipline you choose. And this is a good option if you're looking at more management roles, such as senior biomedical scientist or lab manager. And we've also got the Advanced Specialist Diploma in Histopathology Reporting. So this actually requires quite a long training process for the BMS, but by the end of it, they will be able to look at the glass slides and produce a diagnosis, much like a pathologist would themselves. Thank you.
That's it. Thank you. Thank you, Chris. Next is Alex. Where is Alex? There you are. Halfway down the room. So Alex again is a graduated about 5 years ago, works in microbiology, has been very busy since, so she's going to tell you all about what working in microbiology is like.
Hi everyone. So yeah, I've been working in microbiology for about 5 years now. I'm just going to go through really briefly about some of the things that we do in a micro lab. I could talk all day about everything we do because it's so broad, but yeah.
Green button, sorry.
Yeah, so just like a quick brief overview about my timeline, what I did. So I actually found out about biomedical science through a quiz that I did at school. Until then I didn't really know what they did or where I could fit into it. So in 2015 I started my degree at York St John, which is an IBMS accredited course. I still didn't really know what I wanted to do with my career, and I thought that by doing a placement I'm only going to open doors. So in 2016 I did an NHS placement at James Cook in microbiology, and that allowed me to complete my IBMS certificate of competence. I graduated in 2019 and I was really lucky. I got a job as a band 5 in the same place that I did my placement, so that was really lucky. Not many people get to do that. So in 2020, obviously, we had the COVID pandemic, and working in microbiology, we were one of the first labs in the country to be doing 24-hour testing for COVID. It was very stressful. I think when you start a job fresh out of uni, you don't expect that pressure, but we came out the other end of it and we were all doing really well now. I decided that microbiology was for me, so at that point you can specialise, so I specialised in microbiology, and I then moved on to being a band 6 specialist biomedical scientist. And I've recently just started doing my master's, which is in medical microbiology at Leeds Beckett, and who knows what the future holds. So just a little bit about what is microbiology. So it's the study of microorganisms, so it's just micro meaning small, and biology is the study of living things, so that's basically what we do. And it's split into different categories, so you've got bacteria, parasites, fungi, viruses, and there is prions, but but it's not classed as a living organism, but it is something that we study in microbiology. So a little bit about what we do and how we fit into patient care pathway. So a patient will present with symptoms of infection. So they could have fever and chills, swollen lymph nodes, a rash, fatigue, headache, and they just generally feel unwell. So it's at that point that the clinician would send samples to us in microbiology. They would also send other samples to biochemistry and just to look for CRP, plasma viscosity, they'll do an ESR, and then there'll be an increased white blood cell count. So that's indicating to the clinicians that there might be an infection in this patient. So in microbiology, we receive every type of sample you can imagine. It
smells delightful.
It does. Anything you can imagine, we'll receive it. So the main ones we receive, so cerebrospinal fluid. So we're going to be getting sent that to look for if the patient has meningitis. So that's one of our highest priority samples. We have like a 2-hour turnaround time that we do microscopy on that, and we also culture. Blood cultures were probably one of our next most important samples, and that's to look for sepsis in the patient. So we have an analyzer which we load these blood cultures on, and that's going to monitor the blood culture, and it'll detect rises in CO2 levels. So that would indicate that the patient has got bacteremia, and that would prompt us to do further investigations. We receive urines, that's probably one of our most common samples. We receive them from the hospital and from GP surgeries as well. We receive faeces samples, swabs, and we also provide a lot of screening for the hospital for hospital-acquired infections such as MRSA. We also receive tissues and sterile fluid samples like joint fluids, things like that, to look for infection. And like I said at the bottom, you name it and we've received it. Weird and wonderful things. It's never a dull day in microbiology. So a little bit why I like microbiology. So it's split between automated and manual. So it's a lot of hands-on testing, and also we get to use analyzers. That's mostly for the jobs that are a bit more tedious. So now we've got automated analyzers that do it for us, and it just makes our job a lot easier. So on the automated side, we've got PCR, we've got serology testing. They're mostly used in virology. So obviously like old school testing would be tissue culture, it would be manual ELISAs, which take up a lot of time. So we have introduced automated methods, and that just speeds up diagnosis time. So if you've got a patient that could have viral meningitis, you want to know the result a lot quicker, so we can use PCR for that. Another automated method is using MALDI-TOF, which it works like mass spectrometry, and it's how we identify our bacteria. So when we would normally use API, which can take 24 hours, MALDI can give us a result in 20 minutes. So obviously that's providing the clinicians with what infection the patient has, and then we can provide them with sensitivities for antibiotics and how to treat that infection. On the manual side, we do a lot of, microbiology is probably one of the most manual hands-on disciplines in pathology. So we do microscopy, we do cell counts, and we do gram stains as shown in the picture at the very bottom. So we would categorise what colour the bacteria is stained and how it looks, and that could provide a preliminary identification for the clinician, and that would direct the antibiotic treatment. That's the word. We also do culture, and we do benchtop identification tests, which would also help to give an idea of what bacteria is growing, which would then go on to the MALDI-TOF afterwards. And we also do sensitivity testing, so that's shown by the disc diffusion method that we use. And we use the zone sizes on that, we compare that to the guidelines that are provided to us by UCAST, and then we can say whether that bacteria is sensitive or resistant to certain antibiotics. So in the pictures there, you can see that the gram stain that we got from this sample was a gram-positive cocci in chains. That would be indicative of a Streptococcus species. From the culture plates, you can see the colonies that have a zone of hemolysis around them, and again, that would say to us that this is a Streptococcus species. In this case, this was actually a group A strep. And the sensitivities there, we would then tell the clinicians, and they would begin treatment. Just got a little case study here. So it's just to prove why we need to get a lot of clinical history from the patient. We need to know if they've had any travel history, because it's going to affect how we process the sample, any health and safety implications that might have. We just need to protect ourselves. We're dealing with bacteria that can potentially be very hazardous to us and to the wider community as well. So in this case, this was a food industry worker who had diarrhea on return from travel to Pakistan and Dubai. So because of this clinical details, we processed this sample in our category 3 laboratory, just because the countries in that area have a lot of bacteria and viruses that are highly contagious and can be very dangerous to us. So it also allows for us to set up extra tests as needed. So in this case, it allowed us to set up a TCBS plate, and the TCBS plate is for growth of Vibrio cholera, and they grow nice and yellow. So that allows us to identify the bacteria that's growing from that sample, and again, we can do a gram stain, which shows these gram-negative curved rods. So again, that just gives us an indication of what's growing. It is a category 3 organism, so we did write in processing the sample in category 3 just to protect ourselves, and that was sent off for typing to Colindale, which is a reference laboratory. So we provide all of the routine work. Anything that might need further testing or confirmation typing, we can send that off to a reference laboratory, and they collect samples from all over the country. They can do surveillance, find out if there's any outbreaks of bacteria or viruses. So this showed to be serotype 01, and if you were looking at the research that was going on across the world, this serotype was involved in an outbreak in Pakistan at the time. So obviously this patient had been on holiday, became infected there and actually not shown symptoms until they got back. Obviously, him being a food industry worker, that poses a massive infection control risk. You don't want that patient going to work. If they haven't washed their hands properly or something like that, they can infect the food, which is then being sold to the community. So it was very, very important for us to get this result, to make sure that the patient was treated. So we have to work in microbiology, we need to work as a team here, and we also need to work with other disciplines just to get a full picture. It's a bit like being an investigator. You've got to collect all the clues, like Hussain was saying, to provide a diagnosis so that the patient can be treated and there's no infection control risk to the community. And yeah, if anybody's got any questions.
Thank you. Our last speaker in this session is Donna, who works with me at the Institute and worked in clinical biochemistry for a very long time, and then more latterly blood sciences, so bridging the divide, did both haematology and biochem. So Donna's going to talk to you about what working in clinical biochem is like, and then after this what I'll ask them to do is each speaker to just kind of stand at the front and you can come and talk to them about the disciplines.
Yeah, I started in blood sciences and then kind of specialist in chemistry, but then went back to blood sciences. So a bit of a whistle-stop tour of clinical biochemistry. It's not as exciting as the others in terms of pictures, I'm sorry. So, I mean, biochemistry is one of the main pathology disciplines though, because it's in pretty much every hospital. I'm not going to say every, just in case, but it's in pretty much every hospital in the UK. NHS England reports that there are over 500 million biochemistry tests performed every year. So if you compare that to the next highest, which is 130 million, which is haematology. So they do a lot of tests. And over 50% of the biochemical tests are related to the management of chronic disease. So biochemistry tests are involved in for your screening, for your monitoring, for diagnosis. So they're involved in sort of all aspects of clinical pathology. Biochemistry is a highly automated system. There's no point pretending to you. If you're working in routine biochemistry, it's analyzers. It's very automated, and it always has been. And it's just become more and more automated. As you can see, if you're doing 500 million biochemistry tests in the UK in a year, you don't really have a choice. You can't do that manually. And there's a vast array of tests performed on one analyzer. So routinely between your two main analyzers, which would be a chemistry and an immunoassay analyzer, you could have 70 tests easily, different tests running on those analyzers. So some examples of analyzers. This is a Siemens XPT analyzer. So the menu is over 115 assays, so you're not going to be running 115 assays in that one analyzer, but that's kind of showing you the capacity that the analyzers have. They run a variety of different tests, but every single analyte has got a different chemical reaction. And so when you're studying that, you will need to know these because they would be involved if you were troubleshooting the assay, for example. Not that you need to know it immediately, but over time you need to learn them. This system has got potentiometric and photometric. So your potentiometric is your ion selective electrodes, sodium, potassium and chloride. And the other kind of tests that you do urea, creatinins, you do your liver functions. So you might be doing ALT, alanine aminotransferase, gamma glutamotransferase. You're doing your bilirubin, your albumin. And you might get different profiles when you're working in biochemistry. So your profile that comes from a GP, you might not do the exact same test as your same liver function test that you do for an inpatient, depending on what contracts you've got. So it can get a little bit complicated. The test, for example, maybe everybody would call in glucose. So glucose is done in this kind of analyzer, and it's used to diagnose diabetes. But there are also other methods. So you've got another analyzer which measures glycated hemoglobin. So it's traditionally used in monitoring of patients who've got diabetes, but it can also be used in diagnosis. So there's a variety of different ways of doing these assays. Siemens Centaur. These are not my pictures. These are somebody else's assays, analyzers. We'll see that they're all the same. So immunoassay analyzer that uses chemiluminescence. Again, this is not uncommon. So these are going to be your tests: B12, folate, ions, your hormones, luteinizing hormone, FSH, LH, estradiol. So diagnosis of lots of different things. I mean, obviously B12 folate deficiency. Vitamin D is automated, so you can do your initial vitamin D screen. Usually if it's high though, you would then send it to your specialist services where they would use a different technology, because these analyzers can't usually detect very well vitamin D, D2 and D3 separately. So they'll just measure your D3. So there are other analyzers available. So the Architect, Alinity, C and I, so you'll see here, there's a bit of similarity. So the C side is the chemistry, which is potentiometry and photometry, which is surprisingly enough the exact same as the seismics. And the I side, immunoassay, chemiluminescence. So you'll find that you get wet chemistry analyzers. So they'll talk about wet chemistry isn't mentioned quite as much now, only because we don't tend to use the dry chemistry analyzers. So when they say wet chemistry, it just means liquid reagents. Dry chemistry analyzers are slides, which they used to use in spoke sites. These days, spoke sites can be major trauma centres, so it doesn't mean as much as it used to. But the dry chemistry analyzers are very expensive, slides are very expensive, and the throughput is low. So these days, almost every laboratory hospital will be doing such a high volume of tests that most of them are not going to have a dry chemistry analyzer. It's always going to be the wet chemistry, and they all pretty much use the same technology, and a lot of them will use the exact same chemical reaction. So the good thing about chemistry is that once you kind of know it, it's going to be the same no matter where you go. So that's a positive. So the type of samples that we would put through the analyzer are going to be urine samples. We're going to use sort of the serums, fluoride oxalates, or plasma. We don't usually put whole blood through these analyzers, mostly to do with the protein gets a bit sticky, and you've got to clean it up, which you have to do anyway, but whole blood's a bit stickier than serum and plasma. But we also put CSFs through as well. So this is an example of a Impeco track system. Other track systems are available. You've got the bulk sample input on the left. This is literally a conveyor belt. We'll put all your samples into the bulk sample input. So the samples that you're going to put through here are those ones that I mentioned. So your SST gel tube samples. You're going to put your lithium heparin, so your plasma samples. Your fluoride oxalate for glucose and alcohol. You're not going to put through your urines because they come in a pot. They have to be aliquoted. Yeah, it's quite hard to get it in a tube. So they come in a pot. Fecal samples, which would not normally be tested in routine biochemistry, would go to your specialist lab. And then you've got your cerebrospinal fluid. So the cerebrospinal fluid and also your paediatric samples are quite precious. Some poor person has suffered a lot to give you those. So they tend to be aliquoted and put through separately. So not every sample goes into the bulk sample input. You would have a sort of stat area where you can put your urgents and where you can put these special samples. But when they go into the bulk sample input, there's a pre-analytical section, so they'll go through and be centrifuged. The analyzer reads the barcode, it knows which tests it needs to do, and it will send it through the track to the different C and I side analyzers to perform those assays. And then it comes out at the end. So usually at the end it comes out and they're sorted, and they might be sorted into, these can be filed, these will get something wrong with them, and these need to go somewhere else. When they come out to be filed, they might sit in a holding rack, because in chemistry, again, you get a lot of reflex testing. So reflex might be anything, so for example, potassium's over 6, automatically go back, get retested. TSH test, so thyroid function test used to be TSH and free T4. About 6-7 years ago, we just test the TSH, and then if the sample is greater or lower than a certain value, it will go reflex. This time, instead of repeating the TSH, it will reflex to a free T4 sample. There's going to be a lot of different reflex tests set up. Some of the sample storage modules are connected to refrigerated units, so they will automatically be filed. So if you need to get a sample back, you've got onto your little computer and say, please give me the sample back. They will only hold samples for about 48 to 72 hours, and that's because of the high throughput and the high volume. There's just not enough storage. So then there'll be a little hole in the side and it just spits it all out into a bin, so you have to remember to change the bins. So biochemistry, highly automated. You do a lot of quality control because every single analyte that's on every single analyzer in a track could have multiple analyzers all connected is going to need to be QC'd. Things like your chemistry analyzers, I mean, I'll show you the picture. So this is like an example track in a lab. You can see how many different modules and how many analyzers there are. So all of your seaside analyzers, so routine chemistry, slightly less stable than your immunoassays, so it might be every 4 to 6 hours you're having to quality control every assay. Obviously it's staggered, you don't let them all go down at the same time. Immunoassays, more stable, it could be between 6 and 12 hours that you're going to be QCing them. But it's really important because you cannot afford to put out a wrong result, because that wrong result can very negatively impact on a patient. If you tell them, oh, your antibiotic's really high, so they take them off the antibiotic, and it's not, and then their infection flares. So biochemistry, although being the least sexy kind of discipline, is really, really important. And also, as I say, it's not so manual when you're doing routine, but every sample represents a patient. And that patient could be you or me or your parents or anybody. So biochemistry is really important, and it's involved in everything. It has been mentioned. All of these investigations are looked at together to try and decide what is wrong with this patient. What are we going to do? But this is example track. So the next one is showing you just inside of a fridge what it might look like when you're manually filing samples, or you've got another analyzer that you put your samples into and it'll file them all out. And again, it'll kind of go, these ones are done, you can just put them away, and they're all barcoded so everything can be tracked. Or it will say these are a problem, and it could be, you know, labels run the wrong way, or it's got a big line down it, or something's happened to it. And it could be these samples now have to be sent away. So certain samples, they might do the routine testing, but then there's still other analysis that has to happen, so they need to go away. So you're sorting a lot of things and checking a lot of things. It's a kind of attention to detail. On the right, you can see the racks. These are example racks that have been set up for QCs, quite a lot of them. You get multi-QCs, so you get some that will test maybe like 20 of your tests, but some of them need to have specific QC material, and then obviously you've got your urines. So there's a lot of QCing that has to be done, and you've got to make sure that you're using the right amounts, the right volumes, that you know what you're doing, you're checking lot numbers constantly, you've got reagent lot numbers to check. So as I say, it is quite attention to detail. You shouldn't assume. And that's one of the things sometimes when things get very automated, that people kind of say, oh yeah, it's all working as it should. It's not. So you need to be aware of what you're doing. And there are other analyzers in a routine lab. It isn't just your big C and I side type. You've got the spectrophotometer, which, as I mentioned earlier, is the CSF samples. So as well as measuring total protein and glucose when they would go through the main analyzer, you can measure CSF for subarachnoid hemorrhage, so bleeding in the brain. So you'll be looking for sort of bilirubin, hemoglobin, and the CSF. And then the osmometer, measuring osmolality, so investigation of fluid and electrolyte disorders. And then, as I mentioned earlier, you get HbA1c, but I do not have a picture of that analyzer. That's becoming maybe less in a routine lab, so it might be in a hub lab, but not in a spoke. And it's just dependent on the way that your lab is set up. Track analyzers can also take HbA1c analyzers. So your track system will totally depend on the laboratory in which you're working. It will depend whether it's a hub or a spoke system. So your standalone analyzers tend to be in your spoke sites, and the track system that you saw will be in a hub site. So yeah, biochemistry, very automated but very important. Thank you.
Thank you, Donna.
So, thanks, Sue. If you were anything like me, you are either at the end of your second year, maybe end of first year, you are somewhere in the degree journey thinking, the day is going to come where I've got that piece of paper and all of a sudden I've got to do proper adult stuff. I've got to start thinking about what I'm going to do next. Thinking back on my own experience, that was a really, really stressy time because, to be honest, I can barely make a decision on what I'm going to do tomorrow, let alone for the rest of my life. So what I'm going to do now is hopefully give you a bit of an insight into how to answer that what next question and how to keep answering that what next question for as many years as you need to answer that question for. So I'm gonna cover a bit of a process. It's a bit of a cyclic process that you will keep coming back on again and again and again in your career. And that starts with a period of reflection. And that sounds really wishy-washy, but it properly isn't. I'll come on and tell you more about it. That reflection will drive the jobs that you apply for and the direction that you choose to take as you move through your career. Hopefully, that will lead you to an interview and a successful outcome from that interview and a job that you will move into for however long. Whatever that journey is, at multiple stages on the road, there is an opportunity to network, to develop, and to grow. And so what I'm going to talk to you about today is how to harness that as you do the reflection, the application, the interview, and more networking still. Once you've got all of that down, it's just a rinse and repeat and keep going until the end of your working life. Which actually it does, Cherie. It sounded much better in my head than it did when I said it out loud. That I'm like, what have I just said? So you've got a degree. If you haven't got a degree yet, you're going to get one quite soon. 4 questions that you need to ask yourself at this point. First of all, what are you good at? That is not the same as what you enjoy. Okay? Often they are, but not always. So question number 1, what are you good at? Have a think about that. What you're good at, could you do it for the rest of your life? Then think about what you enjoy. I would always advocate doing something that you enjoy more than something you are good at. So don't, by my moral book, don't let anybody tell you otherwise. Question 3, what are your immediate needs? You've finished your degree. Do you need to do more study? Is there something pressing that makes that an imperative next step? Or actually, do you need to just detach from education for a couple of years and go and travel or go and work in the charity sector or whatever it is you need to do? Have a think about what those immediate needs are and how they can be fulfilled. Question 4, and this is by far the most important question to ask yourselves at this stage in your career, is what are your values and principles? Because over the rest of your working life, you will find time and again that those values and principles are challenged, and you are going to have to meet that challenge each and every time it happens. Certainly in my career, I have stepped off one direction of travel because it was challenging my beliefs and my morals too much, and I was not prepared to sell myself short for what I believed in just for a paycheck. Once you've asked those questions, it's time to start thinking about the jobs that you want. What are you going to apply for? How are you going to do that? 6 important steps this time. So we've gone from a 5-step path, 4 questions, 6 points for the application. Number 1, have a CV, keep it as a working draft and update it regularly. Even if you have just delivered a talk, even if you have just done some new training, learnt a different skill set, completed a new game on the Xbox, whatever it might be, put it in the CV because it's part of that journey that gives you the skill set that is uniquely yours when you apply for a job. Using that principle of your unique skill set, each job application you submit needs to be tailored. Do not rinse and repeat ones that you used before. It's really obvious from a recruiting side of the table if you've written a covering letter for a different job. Usually those applications go straight in the bin because you've not invested the time to show why you want this job and why it is a good fit against your values and principles. Use your network, people that you know, talk to them. I work at the IBMS now because I talked to somebody that I knew. we talk a lot, but I spoke to somebody that I know. That network, you will trust, you will respect, you will value their opinion, and so the things that they tell you and the opportunities that come from them are likely to be a really good fit for what you believe and what's important to you. Keep looking for jobs. Don't just think, right, I've stuck an application in now, I'm done. Again, more about my career, because this is all about me, of course. When I applied for this job at the Institute, I also applied for a different job that I got an interview for. I was supremely lucky to have 2 job offers to work with at the same time. But it meant that I had the flexibility to make decisions that work for me. Oh, I hope I've gone backwards instead of forwards. It's the story of my life. Be extracurricular. Nobody is a working machine. Nobody. Employers don't want machines in that context. People want to know that you've got a life outside of work and that you do something to detach from work. Speaking in purely HR terms, as employees, we are useless to our employers if we are just a machine that burns out. Okay, so have something that is different to work, that is yours, that you are proud to share with somebody that you might work for. And then rethink your skills. So what, you can pipette. Where else can you apply those skills? Pipetting gives you dexterity. So how else could those skills be used, be repurposed in a different sector? The job I'm doing now relies on skills that I actually gained quite a number of years ago that have just sat dormant, but constantly refined and updated. So use those skills and don't forget them. Key tips when you're applying for that job after you've kind of gone through all of that thought process. Number 1, forget the job description. The job description is not what will get you the job. The job description is there to tell you what you are likely to do on a day-to-day basis. It won't be a full list of what's expected, and there's usually get-out clauses where employers can say, and other duties as required. Forget the job description. There's a lot of nodding here. Yeah, forget the job description. Secondly, use the person specification. This is what they're looking for. This is the skill set they're looking for. If you've looked at a person specification, most of them will say that certain skills are essential or desirable. My advice to you would be, if you think you've got about 2/3 of the essentials, apply for the job anyway. You never know what the competition is going to be like. If you've only got 1 or 2, you're probably wasting your time. But if you've got a decent number of the essentials, sell yourself, drop in the application. It might sting initially to get a rejection, but a rejection from a job that in your heart of hearts you know isn't the right fit for you will enhance your skills and your ability to deal with the inevitable rejection of a job that you think you really did want. So make sure that you work that person specification. Use the STAR technique. This is talked about quite a lot on LinkedIn and other kind of like CV hunting and job searching websites. The STAR technique is the in vogue core of competency-based job interviews at the minute. The idea of the STAR technique is that it will help you answer questions like, give me an example of when, tell me how you did, if this situation happened, how would you handle it? So the STAR technique is all about situation, task, action, response. So what was the situation that you were faced with? Give a bit of context so people understand. What was your task? What was your input into that particular situation, that particular problem, that particular solution? What action did you take? How did you solve the problem? How did you overcome the challenge? How did you deal with the difficult employee at work? And then what was the result? How did it all finish? What was the feedback? Close the loop. The other thing, I've done it again, gone backwards. The other thing with the, I know, they are, they're even red and green. The other thing I would say is give yourself time. It will inevitably take longer than you think to apply for the job. So don't do it the night that the application is due in. Give yourself plenty of time. So you've submitted it, it's gone. It's in. The job application is done. The first thing that will happen will be long listing. This is where somebody who is not usually a discipline or subject specialist will sift through the pile and say yes or no based on some predefined criteria. At your stage in your career, it is likely to be, do you have the right degree? Are you fresh out of university? That kind of thing. Okay. The long listing is designed to give a list of people who could, on the face of it, do the job that the employer is asking for. Then it'll go to shortlisting, and shortlisting is where the particular skills and attributes that you're presenting in your CV and covering letter and application questions will be scrutinised, often by the person who's going to be your boss. So you need to make sure that if you get to the shortlisting stage, that you shine through as you. Okay, so don't use great big words that you don't understand in the application form. Use words that represent you. Okay, make sure that your personality, your humour shines through. The third point is the interview itself. If you are offered an interview, there is something on your CV and in the application form that the employer wants to hear more about. They're interested in you, but they don't want you yet. Your job in the interview is to convince them that whatever they've seen that they're interested in and how you present on the day is exactly what they want and need, and their company can't keep existing unless you are on staff with them. Okay, the interview is all about selling you. Principally, the interview will see whether you fit with the team. Are you the right skills mix? Do you have the right personality? Is your humour appropriate? Do you present in the way that the company would be happy to send out to represent them? You need to do some work here because you need to find out, if you can, what it is that's made the employer interested in you. Are they interested because it's, in the grand scheme of things, a relatively junior role? Is it just that they are looking for graduates so that they can train them in the way that they want them to be trained? Or do you have a particular managerial skill that they're looking for? Or have you used a particular technique during your final year project that actually they're struggling to get technicians to work into? So if you can, find out what they're looking for. What you're doing here is making them want you. I've done it again. So find out who's on the panel. If you can, give them a ring. Speak to them. The jobs that I have felt happiest in, and the interviews that in the end have obviously been given the job, but the interviews that have felt the best for me, very often the ones where I'm least nervous as I go into them, are the ones where I've rung somebody up in advance and I've been and had a look at the lab. I've spoken to the person who's going to be my boss, and I've kind of got to see what makes them tick. Because that means that then I go into the interview knowing a little bit more about what they are looking for. And the key point of an interview that I'm going to come on to in a minute is that it is a two-way street. Yes, they are seeing whether you are suitable to go and work for them, but also, do their values and principles match up against yours? If you don't want to do shift work, don't apply for a shift job. Okay, it's as simple as that kind of stuff. If you get to the stage of the interview, then again, apply the STAR technique to the questions that they ask you. Okay, so when they're asking you the questions during the interview, use that STAR technique: situation, task, action, response. And also, prepare plenty of time in advance. If you don't know where you're going, rehearse the route if necessary. Check that if you're driving for a 9 o'clock interview, don't rehearse the route at 4 o'clock on a Sunday afternoon, because you'll inevitably be late. Make sure that you're appropriately dressed. Get a friend to help you with some of the common competency-based questions and rehearse what they're supposed to be. Rehearse what your answers need to include and get some really honest feedback. Show your skills and experience. Do it in context and do it in every single answer. It's a time for you to shine, so don't make the interviewer do all of the talking. Your voice needs to be the one that's heard loud and clear throughout the interview. Think about your strengths. think about your weaknesses, and do not sell a weakness as something like, oh, my weakness is I work too hard. Yeah, right. My weakness is I'm often 2 or 3 minutes late, and I'm really trying hard to make sure that I set an alarm so that that doesn't happen in future. Present a weakness and show how you are addressing that weakness, because that makes you a better employee, because you are self-aware. It is a two-way street. Do you see yourself working there? Could you be managed by this person who talks incessantly? Why are you laughing, Sue? Who would that be? So could you be managed by that person? And ask probing questions. Show that you're interested. Show that you've taken the time to find out about their research, or what they're a reference lab for, or something like that. If you've done your due diligence, it should be really easy to ask those questions. Ask about working patterns, particularly if it's part-time or shift or that kind of work, or you have a particular situation where you've got caring responsibilities or kids or whatever. Ask about those things in the interview. It's too premature in the interview to ask about salary and leave. They haven't asked you to work for them yet. That set of discussions, if you get them right, will set you up for a really well-paid career with loads of holiday. So give those discussions, which are important, the time that they need. The time is not during the interview. And then use your network. Reflect on how the interview went. When you came out of the interview, how did you feel? Not about whether you answered the questions, not about whether you forgot to mention something that you now think is important, but were you authentically you, or were you putting on a mask? We all know, because of nerves, that there'll be a little bit of a mask there, but you still need to shine through. If you think of something afterwards, write it down, because if they ring you back to offer you the job, you can ask them then. If they don't offer you the job, then it's not really a relevant question to ask, because they've not offered you the job. If they do offer you the job, plan. What are you going to do? When do you need to start? Do you need to move home to be able to do that? Do you need to go and get some clothes? Do you need to tell them about a holiday that you've got coming up? If they don't offer you the job, how are you going to handle that? Is that going to sting because it's a job that you really wanted? And if so, make sure that you've got some kind of self-care in place so that you can handle that rejection, because it's never nice, particularly when you've spent time trying to prepare for a job that you want. If they don't offer you the job and you didn't really want it because you didn't like the manager on the day or whatever, shake it off. Don't worry about it. Don't sweat it. If they do offer you the job, what parameters are you working to? Don't just say yes under any circumstances, because that can get really unpleasant really quickly, and you just end up in a job that you potentially love but hate because of some kind of circumstance that could have been worked out at this stage. Don't try and do anything else on the day of an interview. They are always draining. If you gave your best performance, you will be knackered when you come out of it. So take the rest of the day off, do something you enjoy, take your mind off the interview, and do not dissect your performance. It's done. You cannot change whether they're going to give you that job now or not, so it's pointless worrying about it. I say this as the kind of person that will do nothing other than worry about an interview when I come out of it. Try to just learn from the experience. If you do think that you answered the questions badly because you rushed them or you missed something important, what could you do in future to prevent that problem coming out again? And that's it. Thank you very much. If anybody's got any questions, I will happily answer them.
Has anybody got any questions? We can do a couple of quick questions and then we'll move on to our other graduates. Yeah.
It's just that initial sort of, how do you approach the panel? How do you know who's on the panel? And how do you make that phone call without it being off-putting?
Yeah, really good question. So, this is the bit where potentially you have to just put a bit of a mask in place, particularly if that kind of very forward approach is something that you would find a challenge. So for a lot of jobs, when you are invited to an interview, it will say who the panel is. So it'll either name the people or it will say laboratory manager or whatever. A little bit of Googling nowadays will find an email address or a phone number that you can ring. and just send them an email. Literally say, I've got an interview and I'd like to talk to you informally about the job before we get to the interview. Or I've seen that you've got this post out. Most job adverts now will say, if you want to talk to somebody informally, give this person a ring or send this person an email. Literally send them an email and say, I'm interested in applying, but I might need to move geographically, so I'd just like to come and have a look at the lab, or this is a new discipline to me, I've only just graduated, I'd love to come and see how you do things based on what I saw when I was at university. So white lies are allowed at this stage, so if you need to just tell a little bit of a white lie to give you the excuse to make the contact, that's absolutely fine. The key is, when you get there, have something sensible to ask. So, you know, if you're going round the labs, why is it that you want to go round them? Because these people are taking time out of the day to show you around, and if they understand what you need to get out of that visit, they can kind of answer your questions for you. So when I first started working with Sue years and years ago, 1 or 2 years ago, not lots of years ago, when I started working with Sue, yeah, I think we were both about, I think I was 4 and you might have been 5. So when we started working together a long time ago, I literally went and said, right, I've got a list of questions. And instantly, I now know, looking back, Sue put a big tick in a box because I'd gone prepared with a list of questions about things that I needed to know. And of course, that made Sue's job really easy because she was just able to rattle down the list with me and answer them all. That meant then that when I put the application in, it was better tailored to the job description and the person's specification because I'd had that conversation with somebody. And so I was able to really specify what I thought was important about the job.
Just if I may bounce off that, from my point of view, where I've sat on interview panels, it's so infrequent to get people making contact and saying, I've got an interview, I'd love to come and look around. I love showing people around the lab because you're almost having a pre-meet.
Yeah.
You know, in that little bit of conversation as you walk around, you're kind of getting to know the candidate even before the day. You know, that bit's not scored, but they're sizing us up and we're almost sizing them up as well. So in my experience, it's so infrequent that what have you got to lose?
Yeah, and you go into the interview already being known for the right reasons, as being the person that went out of your way to go and find out a bit more about the job. Do it every time. Every time, do it.
Initiative and doing some research, isn't it? When the placement students were talking about getting ready for their interviews, that's what they did, wasn't it? Find out about the company, have questions to ask, that kind of thing. I think in interest of time...
I was going to say, are we over time? I was just chatting away.
You were fine. No, you were fine. So next it's Lauren, isn't it? And then Abdul is on last. So Lauren's going to speak to you again. Lauren graduated 5 years ago?
Yeah, 2018.
2018, 5 years ago. And since then, Lauren has done a postgraduate course that she's going to tell you about, and she's now a physician associate. So Lauren's going to talk to you about her experience and becoming a physician associate.
Thank you so much for having me today. So my name's Lauren, I'm 26 years old and I'm from a small town in the northwest called Clitheroe. In November 2018, I graduated from York St John University with an honours degree in biomedical science. And then in the following February 2019, I went on to study a master's degree in physician associate studies at the University of Manchester. And now I am fully qualified, working in respiratory medicine at Royal Preston Hospital, Lancashire Teachings Hospital Trust. So today I'm going to speak to you about further education following your degree in biomedical science, and in particular physician associate studies, what a physician associate is, how I got to where I am today, why I wanted to become a PA, and a bit of a day in the life of what we do generally. So what is a physician associate? We're medically trained healthcare professionals. We work alongside doctors to provide medical care, and we can work independently under a clinical supervisor, and we are across all different specialities. So we have PAs working in general practice, general medicine, and speciality areas as well, so paediatrics, surgery, mental health, and A&E acute medicine. So what can we do? So we would go and see a patient, we would take medical history,
perform clinical examination, request investigations, and then interpret those investigations to come up with a differential diagnoses, and then hopefully formulate a management plan to help that patient. We also do therapeutic and diagnostic procedures. So in respiratory, we do a lot of pleural work, so taking fluid off the chest, inserting chest drains. My colleagues in gastroenterology, he is doing some kind of training to be able to perform endoscopies, and some of my surgical colleagues assist in theatres, so there's quite a lot of exciting things that we do. At the moment, we are not able to prescribe or request ionising radiation, so CT scans, chest x-rays. That's because we're not currently regulated in the UK. So in 2019, the General Medical Council were asked to regulate us. However, with COVID and Brexit, that's kind of pushed things back a little because it needs to go through legislation, and the government have been a bit busy. So the next consultation is due to be early 2024. So we're really hoping that does get there, because it would be really useful for us to have our prescribing rights and also request x-rays and things. But it doesn't hinder our practice too much, in particular working in secondary care on the wards, because there's often a lot of doctors around that are able to support and help. So why did I want to become a physician associate? I will answer this question at the end. I'm conscious of time, and I think if anyone's got any questions, I'd rather tell you the information you need to know rather than just talk about my experience. So in terms of what you need to do to be able to become a PA, you need to be predicted a 2-1 in a healthcare science degree, or an allied health professional. So we come from a variety of backgrounds, a lot of biomedical scientists, biochemists, human physiology and anatomy, and then also different professions, so pharmacists, paramedics, physiotherapists. We've got a huge array of different backgrounds, and more recently some universities have now require the UCAT, which is essentially like an admissions test, just because it's becoming more popular. And also it's really important to get some relevant work experience. So I don't know for everyone here, but for me personally, I didn't have any family in the medical field, so it is quite difficult, I appreciate, to get onto the wards or to get into a GP practice for experience, but you don't have to always do that necessarily. So you could go and get a job as a HCA, do some work experience in a care home. I volunteered at a hospice for a couple of hours a week whilst I was studying, and it's mainly the learning experience that you gain from that and how you're able to apply that to your role as a physician associate, which is the most important thing for you to take away. In terms of training, so obviously, generally speaking, it will be slightly different for every university, but it's a 2-year programme. Some universities offer a postgraduate diploma and some of them offer the masters. I just want to mention here that funding is one of the downfalls of this course. So it's a 2-year master's degree at £9,000 per year. Now if you do the masters, which for me was an additional 5,000 word research project, you do get the £10,000 funding, so it was definitely worth it. And in your first and second year, it's very placement heavy. So the first year you run 6 placements in general medicine, and then the second year is when you do your specialities. In between that, you're at university. Usually at the beginning of the years, you do like quite a large block of lectures, workshops, communication skills sessions. Often we get actors in to play the role of a patient, and you then would practice your communication skills, information giving, breaking bad news, and also clinical skill workshops as well. Some extras that are included in some university courses, so especially with mine, we did integrated training in prescribing safety in anticipation for the legislation change. And at Manchester University, they have a special laboratory for patients who have donated their bodies to science, and we use that for our hands-on human anatomy based teaching and learning, which was really special. And some placements as well, you can arrange for them to do anywhere abroad, so that's also a good experience. So just a bit of a day in the life of what I do. So as in secondary care, I spend a lot of the time on the respiratory ward. We've got a high care unit and the general respiratory ward, so we do the ward round, prepare patients, look at the investigations, determine where they are up to in their treatment plan, chase up any outstanding investigations, review blood results, review scans. We might have a chat with microbiology about antibiotics, or I don't know, request a cardiac monitoring on a patient. So we kind of work quite heavily on the wards, and if there's anybody particularly unwell, we'll go and see them and devise a management plan. And then I also do quite a bit of in-reaching into A&E, so that's where we go and see respiratory patients to try and reduce the length of stay, bring them up to the ward sooner, or discharge them. And we have now just set up a virtual ward, which was initially run by physician associates, so we would remote monitor patients. And then I also do a general thoracic clinic where I'm able to see my own patients with chronic respiratory conditions. So there's quite a lot of variety within the role within respiratory, and then again, as I mentioned earlier, getting hands-on with some of the more diagnostic and therapeutic procedures. And I also have recently undertaken an educational role where there's 4 of us in the trust that try and develop educational kind of opportunities for physician associates in the Northwest. So we've developed kind of PA teaching and different kind of workshops and things for PAs within the trust. In terms of additional responsibilities, so once you are qualified, you do need to maintain your professional development. So we have to do 50 CPD, get 50 CPD points a year. So that's attending kind of learning experiences, reflecting, and we also have to perform a number of kind of case-based discussions. So any in particular cases that we've learned about, we will write that up and have a discussion with our senior about how that patient was managed. Again, clinical skills, so venipuncture, cannulation, catheterisation, NG, tube insertion. And then we're also involved in audits and quality improvement projects. I'm currently doing a research project actually about fast sputum analysis and whether in patients with hospital-acquired pneumonia, and whether this can improve kind of outcomes based on the microbiology sensitivities. And finally, every 7 years, so initially every 7 years we would have to resit an exam to maintain our competency. However, they've just scrapped that now, and we're now having to every year do a portfolio of a criteria which is due to come out in October, so that will ensure that we remain kind of validated and maintain on. At the moment we're part of a managed register which is run by the Faculty of Physician Associates. So yeah, that's just a whistle-top tour of PA studies. Thank you for listening. If anyone has any questions, I'll be around after and I'm happy to answer.
Thank you. We'll go straight into Abdul's talk, and then we'll just ask Lauren and Abdul to stay at the front so you can ask questions before you need to go. So Abdul, if you'd like to come up. Abdul didn't go to York St John, everyone. He went somewhere else. We've had a lot of students from York St John.
But you were a lecturer?
I did teach him as well. Yeah. So I pulled a few favours to get people here for you this afternoon. So yeah, Abdul graduated in 2010. 10, long time ago. So Abdul graduated then, and he's going to talk to you about what he's done since then. And you've got loads of different experiences to talk to them about, haven't you? So I will leave you to it, and I'll just go to
Thank you very much. So I'm going to talk about industry experience and moving from the lab to the corporate world. And this is actually a good segue from Jim's talk earlier, because I had to make some decisions after I graduated. So I'm going to talk about the choices I made, moving into the lab, and then my role in industry. So how did I get to where I am now? So I graduated in 2010, and after months of applications, and probably more than 40, 50 applications, I got nowhere. I was just waiting, and it was about 8 months into, 8 months after, where I had 2 come up at once. So I applied for an MSc in biotechnology because I loved the practical element of my degree, and I also applied for an NHS role as an MLA. So I had to make the choice: do I start the masters, or do I go into and get some experience as an MLA? I decided to choose the MLA role, and didn't go down the MSc. So I thought, let's get some lab experience, because I thought, if I do an MSc in biotechnology, will I be in the same position where I'll be applying for jobs? I had to make that choice. So I won't go through my whole career in the lab, because you've heard what someone as an MLA, AP and biomedical scientist does, but what I do want to reiterate is that experience that I got in the lab was the foundation for where I am today. So all the lessons learned as an MLA, as an AP, I still use today in my role. Life in industry. So I was a BMS, and then I heard about a job as an application specialist with BD. BD actually has BD has a stand out there as well, so go visit them. You can learn all about what they do there. But I applied as an application specialist for the UK and Ireland. And one of the things that I did when I applied for that role, Jim mentioned it earlier, was I actually came to IBMS and met with my potential manager, other positions there as well. So I did some research, some networking as well. I got the job, but I also, something else as well, I was in the lab when I heard that there's going to be an application specialist role coming, because the application specialist for BD at the time that came to our lab, I worked at Salford Royal, he said he's leaving. So I went in the corridor and I said, you're leaving, how do I apply for that job? So I actually just asked him, and he actually helped me, told me what I need to do. He didn't say I'm going to guarantee to get the job, but at least I made that first step to probe some questions. I then moved into a global healthcare consultant role. And again, I'll talk to you about what that job entails. And then at the moment, I'm working as a global manager for professional services as well. But one of the things that I want to reiterate as well is these jobs didn't just come easily. After graduating, one of the key things that I do want to make sure that you know, and what I've learned, is that you might have to do further study. Whether that's CPD whilst you're in the lab, or just a short course. It's not clear there, but I can talk to you and answer any questions on those later. But I did a course in Lean Six Sigma. I got my green belt, so there are different belts, and the highest one is a black belt, so I got my Lean Six Sigma black belt qualification as well. The one on top of that is becoming a master black belt. And again, I won't go into the details of what someone as a Lean Six Sigma black belt would do, but it's about process optimization, and that helped me with my role as a global healthcare consultant. So we talked about improvement in the wards, in the labs. It's usually Lean consultants or Lean Six Sigma consultants that will support that. In the labs, it's about optimizing processes. Again, I'll go into more detail of what that entails. I currently just finished my master's in my MBA, Master's in Business Admin. Again, one of the reasons why I want to do that, and I'm doing that, is because I look at potential jobs that I could apply for. It's usually MBA preferred. So my next role will probably be, the MBA will help me with my next role, basically. So I always look at, what do I want to do next? What do I need to do to get there? So I'm a scientist by trade, really. My degree was biomedical science. I have no marketing experience. I have no operations. A lot of the roles that I could potentially apply for are marketing management, operations role. The MBA will definitely help me if I want to apply for one of those roles. So again, this talk isn't about BD, but just to give you an example of the solutions. Again, if you go to the stand, you can find out all about them. But some of the products in the division that I work for have blood culture bottles. So we heard Ella worked in the micro lab, and she talked about blood culture bottles. We supply the blood culture bottles as well as the instrumentation. We supply the tubes. We supply automation for different parts of the lab processing in the microbiology lab. Blood culture instruments. We also have molecular instrumentation as well. So a wide portfolio of instrumentation. The reason why I want you to know what we do is because my first role, as I mentioned, as an application specialist in industry, required me to know about this instrumentation. But I needed the clinical lab experience, as I mentioned before, so being an MLA, being an AP, BMS really helped me with that role, because I knew exactly what that position entails, how they utilize the instrumentation, so I could really build that rapport when I'm going to a customer, so going to the lab. So my customers were the lab. So this role, I was covering the UK and Ireland, so it did mean, even though I was in Manchester, I'd probably be in Inverness 1 week, I'd be in Ireland another week, so it does mean there's a lot of travel within this role. But I got to meet different labs, I was exposed to the way the same sample, whether it's a CSF or blood culture, is being processed in a different lab. So again, I could see, how things can be different, but also how things are the same as well. So again, I built my experience, my knowledge, my network within this role. So I support the sales, so I would go to a potential customer that would probably buy a blood culture instrument and do a lunchtime presentation. This is our instrument, this is how you would process the samples, these are the benefits, and support the sales in that activity. So again, the application specialist role would have that scientific background, that knowledge of the instrument as well. If the customer then decided to buy that instrument, I would then support them with their validation, their verification work. I'd also give them additional training and support them during their implementation until they went live with that instrument. And then obviously, once you've got the instrument in the lab, it doesn't end there. I would then support as an application specialist if they've got any technical issues afterwards, or if there's updates or upgrades to the software. I would then go back into the lab and teach them on the new software, sometimes install the new software as well, depending on experience as well. Now, as an application specialist, again, talking about network and it being exposed, I worked with sales, engineers, European application specialists. So from being an application specialist, I could potentially move into a European role as a European application specialist to support all the application specialists within the European region. So each country, I'd be responsible for them. So that's another role that you could look into. I'd work with technical support, so over the phone. Again, that's another role that you could potentially apply for after graduating. And product managers as well. So we have product managers that manage the portfolios of the blood culture instruments within the UK. So again, this was the foundation of one of the roles. The next role that I applied for and was successful, remember I did a Lean Six Sigma Green Belt and Black Belt qualification to help me get the next role, which was the Global Healthcare Consultant role. So this was a big step. Again, each of these roles had huge learning curves as well. So I had the appetite to do it. I got the role, and I think that's what impressed these managers, was the fact that I was determined to learn and had some of the foundational skills. So you can see in the bottom left, the clinical diagnostic experience was still fundamental for this role. But one of the things that I learned doing the Lean Six Sigma Black Belt and Green Belt qualification was the continuous improvement mindset, workflow mapping and design. So as a healthcare consultant, if you think about automation in the biochemistry lab, microbiology is moving in that direction. There's a lot of consolidation, big lines going into the micro labs now where samples, the inoculation is automated, etc. As a consultant, I would go in there to look at their current workflow and help the sales to say, this is how you can improve your workflow. As within my role, I also did training, coaching and mentoring, so that's internal. So I would train application specialists on how to do some green belt equivalent consulting. Once the system's gone in, so big, again, I'm not here to sell the Keystra system, but the BD Keystra system is a total lab automation solution, shall I say. I would then go in there to see how there's other room for improvement, look at the data, analyze the data with the lab managers and say, if you process your samples, maybe at this time you can find some efficiency gains by doing that as well. As you can see in the teams, I work with marketing in the healthcare consultant role. I work with application specialists, product managers, project managers as well. So if you think about big lab transformations, project managers is a key role as well. So again, you might graduate and you might want to do a qualification in a short course on There's like prints, etc., that you might want to look into as well if you want to go down the project management route, and they are fundamental for these big lab transformations as well. So I worked with them. You may want to consider R&D roles as well, and I actually support R&D with new product support as well. So with my experience in the lab, me traveling around the world, so in this role I actually traveled to like San Diego, I was in China, in Wuhan, I was in the Middle East, I went to Africa, so there's a lot of travel involved. Again, they're still doing the same thing that you're doing in a microbiology lab in Salford, which is process a urine, but they might just do it slightly different. So it's learning, they might do it better, so I can go back to another lab and say, have you ever considered doing this? And that's what a consultant does, looks at ways to improve and help the lab. But working with new product support, what I could do is, for example, the blood culture instrument. So if I went to a lab and taught someone how to use that, new students usually are the ones that give a lot of feedback and ask questions, but why do we do it this way? Or things that we've never considered. So I can't talk about the new products that are in development, but I can relay that information to R&D and say, this is the feedback that we've had, maybe you should consider doing it this way. Staff scientists as well, we have staff scientists that work for us that will do some of the testing as well, so it's a fundamental role before the product actually goes to the customer or before we launch a new product is the work that goes behind that. So that's the healthcare consultant role. We use an engagement model. Again, I won't go through that in detail, just conscious of time, and I can see the next speakers are here as well. So in terms of workflow optimization as a consultant, if you think about the lab and the different workbenches, sometimes it's not optimal. You might go and get a reagent from over here, then work to a bench over there. So as a workflow consultant, we would go in and map out, do some spaghetti diagrams, do the calculations on how long it's taken to process that one sample, and then say, actually, if you implement this, you'll be able to find gains. So that's just a snippet of what a consultant would do. I now work, as I mentioned, I'm a global manager for professional services. So as part of that, I do the lean training development, some of the materials for customer facing. So the role that I'm in now is very internal within the company, but I'm developing material that can be utilized by the sales of the applications, etc. So again, you can see all the skills that I learned from being an MLA, AP, BMS, and the roles. I've just continued to support the role that I'm in now. So with that note, I just want to leave with a message. So Taichi Ono is he is renowned for TPS, Toyota Production System. And so progress cannot be generated when we are satisfied with the existing situation. So again, that's something that I learned even after graduating, and I thought, I need to do something and make a choice, etc. So hopefully something to take home. Any questions, I'll be around. Thank you very much.
So our technician in the office has just asked me to film for a minute or two because our two last speakers of the day here, and we just need to get the slides on the system. So would you like to come and join me? We can say hello and introduce you to everybody, and hopefully that will give you time to get the slides organised. So do you want to follow me around here? So it's really, really simple to do. It'll come up, and then we just press the green button to go forward. And the slides are really straightforward. So I'm delighted to introduce to you two colleagues. You can see in their beautiful uniforms that they both work in military forces. So we've got Brittany, who is in the Navy, and we've got Tahmina. I knew I was going to say it wrong. Tahmina, who is in the Army. So do you want to tell people just a little bit about your sort of normal roles, and then once the slides come on, we can just go into them.
Yep, so I'm Brittany Henry. I joined the Royal Navy 4 years ago. I knew I wanted to do something in science and healthcare, and it was actually a Navy nurse that I came across, and he told me that this role was available in the military. They actually paid and they funded my degree in full, and then I went on to study at Aston University here in Birmingham, and now I work down in Portsmouth at the Queen Alexandra Hospital, just doing my specialist portfolio and preparing to go abroad to practice as a biomedical scientist.
So I'm Tahmina, and I graduated from Kingston University. I fully funded it myself, and then I decided to join the Army as a military BMS. So I actually just did my registration portfolio with the military in Birmingham Hospital, Queen Elizabeth, and then now I'm based in Portsmouth, and that's where I'm doing my specialist portfolio.
Amazing, and as if by magic the slides are almost going to appear. So they'll appear in slideshow, and then once they're on slideshow, you can just start the presentation.
Okay, great. Before we start, can I get a show of hands to see how many of you know or have an idea of what we do in the military as BMSs? Kind of over there, yeah.
Good job to do that.
No, brilliant.
Does anyone have any interest of like joining the military? Okay. Okay, shall we?
I think it should be ready. Do you want to try?
Yeah, I think it's ready.
I think you just began with the settings.
Do you want to?
Yes, your first slide is up on the screen, so I think it should be.
Thank you.
Okay, so our presentation today, we're going to talk to you a little bit about what we do and basically how we got here as well. So our journey about how we started off as students and then joined the military and what we're doing currently.
Yeah, click it quite hard. Perfect.
So we're going to start by discussing the training and education requirements for our role, clinical placement locations and completion of the IBMS registration portfolio. We're also going to talk about personal development opportunities that are available to us. And finally, we're going to discuss the important role biomedical scientists play in medical teams that are deployed overseas.
So as you can see on the screen, this is essentially a simplified training timeline, and it begins in phase 1, which is what we call basic training. It's what all soldiers and recruits have to go through, and it meanders all the way through to produce hopefully a fully qualified military BMS.
So for the Army, training starts in Purbright, Surrey, which lasts up to 14 weeks. This is where we learn basic soldier skills such as navigation, section attacks, field routines, and rifle handling. During this phase, I learned to operate at peak performances physically and mentally, regardless of the situation. Core values, military ethos, and discipline is drilled into us within the 14 weeks.
And for the Navy, training begins at HMS Raleigh, that's in Plymouth, and this took place over a period of 10 weeks. Recruits come from all of the UK and overseas, and it was there that I was given a taste of the skills that I needed to work or train in the future. This included learning how to tackle floods and fires when I was at sea. And finally, we've got the RAF. Their training takes place in RAF Halton, and that's also for a period of 10 weeks. They do things like general service training, they have daily inspections, they learn about marching and drill. And as you can see, we have biomedical scientists across all of the 3 services, meaning that nowadays, Navy BMSs can deploy to field hospitals and Army BMSs can come on ship. And this is what we call a truly tri-service environment.
So this is a picture of me as a graduate from Kingston University, where I was a civilian, and then the picture on the right is of me ready for the final section attack as a soldier. So one key lesson that I learned from basic training was soldier first and then your trade. This was to highlight the importance of having good soldier skills and not just being good at being a biomedical scientist. And my favorite phrase from basic training is each man is a link man, which means that it's vital to learn the value of your team.
So first on the timeline is university. So professionally, we require the same qualifications as civilian BMS. This includes an IBMS accredited biomedical science degree, which I began studying here in Birmingham at Aston University in 2019. I also studied with 3 other military BMS, 2 of which had completed access to higher education courses, and the other, like me, had done A-levels. So aside from this, there are other entry routes into the military. This includes coming in as a qualified BMS, i.e. you're already holding your HCPC registration. Alternatively, you could be a reservist. So these are individuals who want to combine their civilian career with a military one.
Next on the training timeline, we have clinical placement. So during the summer term of, oh, that's you. Okay. So initially we start our clinical placements at Queen Elizabeth Hospital. This is where we do our registration portfolio, and whilst we're there we get rotated around biochemistry, haematology, transfusion and also microbiology. The exposure to multiple disciplines makes us aware of how the different areas of pathology fit together and is one of the major differences between military and civilian BMS.
So next we're going to talk about our transition to military practice course. So this 4-month course is where we get introduced to military procedures and lab equipment. So this includes smaller, lower throughput analyzers. We even have our own military request forms and our own laboratory information management system. It's where we really get to combine all of the skills that we learn at university and on placement and apply them specifically to military settings. So this involves providing blood to what we call Medical Emergency Response Team, and that's known as MERT, or Critical Care Air Support Team, called CCAS. Essentially, we learn how to run an entire lab as a team of 3 and even prepared for situations where we could potentially be a lone BMS.
So after TTMP, we have our first postings. This is where we further expand our clinical skills, and we also complete our specialist portfolio. We have a presence in 3 main areas of the UK and are known as Defence Medical Groups. Defence Medical Group South, which is in Portsmouth, Defence Medical Group South East, which is located at Frimley Park, and Royal Centre for Defence Medicine, which is at Queen Elizabeth Hospital in Birmingham.
So next we'll explore some personal development opportunities that are available to service personnel. So we undertake regular physical training each week, and we have fitness tests that we must pass, and all of these vary according to service. But outside of this, there's loads of opportunities to get involved in sport, and currently I'm involved in the Royal Navy Women's Golf Association, but I'm looking to get into rock climbing and some hockey. And additionally, there's opportunities to get involved in adventure training. So this is more specialised outdoor activities, which can be in the UK but also abroad. So you get to take on things like mountain biking, skiing and even parachuting.
So we have various coaching, mentoring and leadership courses which are open to service personnel. In addition to this, there are standard learning credits which are available for any courses that you're passionate about. And you get up to £175 for the year, so we have to make sure that we use it because every year it gets renewed. And people have even done driving courses, wine tasting, and learnt languages using the funds.
Get on board with that.
And then once you've served 8 years, you get enhanced learning credits. And this means that funding goes up to £2,000 a year, and this is for 3 years, so you get £2,000 every year for 3 years. And this is all funded by the military. So recently, me and Brittany went on a Innovation Fundamentals course, which was completely funded by the military, and we got a week off work as well to do it.
This had nothing to do with our jobs, we just thought we'd have a look at doing something else.
So yeah, there's loads of opportunities there. And there are also other opportunities to take control of your career and contribute to the unit. This includes organising team building and welfare days. There are various annual unit events such as the summer and Christmas function. These are great opportunities to meet other members of the unit in a more relaxed environment. So as you can see on the top right, that's when we went to Ben Nevis and we climbed that, and we got time off work to do that as well because that was a team building activity. And on the bottom left, that's when we went go-karting, and that was really fun as well, and we got time off work. And the one on the bottom right, that's from a Christmas function from last year, and it's always good, the functions. They're always lavish and fun.
So next we'll give you a short insight onto the work we do on deployment and the training that's required for it. So at this stage we're fully qualified military BMS ready to deploy. However, there's a BMS training school in Birmingham that provides extra support through pre-deployment training. We also have opportunities to go on exercise where the deployed hospital is replicated, and we do this with the people that we're going to deploy with. So this could be other military nurses, ODPs, and radiographers.
So the picture on the right is actually of a recent trip that me and Brittany went on to a field hospital in Colchester. This is where we went to help pack kit for deployments for 16 MedReg. And the BMS that's posted there is on high readiness, which means that they could be given 7 days notice to deploy. And sometimes they can even be given 24 hours notice to move, which so then they have to be within 1 hour from the camp. This is why it's vital to always have your kit prepared and packed, ready to move. Deployments can be in areas such as Turkey, Kenya, Norway, Nepal, and Oman, all of which come with various challenges that ourselves as BMS are trained to overcome. So next we're going to show you a video of the biggest lab setup we've ever had on deployment. This video was taken in Camp Bastion in Afghanistan, which was established in 2006. Camp Bastion covered an area equivalent to the size of Reading. The base was home for up to 30,000 international servicemen and women. As well as providing accommodation, it acted as logistical support centre and had a substantial field hospital.
Well, we've got some slides of our setup on deployment. So you can see our essential kit and basically the shared spaces with other members of the medical team. So here you can see our blood storage units on the right. We've got centrifuges on the left, Sahara in the back, our little sharp spin, because of course we've got to dispose of our waste naturally, even though we're on deployment. And that little laptop you can see in front of the sharp spin is our LIMS. It's not the biggest setup, but it's all of our essential kit, and it actually allows us to provide a BMS service whilst we're away. Here's just another image of the deployed lab. It's really up to us to pack all of our kit to ensure that it all arrives on time, and it's up to us to figure out how we want to arrange our lab. It's pretty much self-managed, and only then can you declare that this lab is fit and ready to receive samples. So that's all we've got time for today. Thank you guys for listening.
Thank you.